Great, thank you. Welcome to this meeting of the Children and Young People Scrutiny Committee, being held on Tuesday, the 23rd of January 2024. Fire and emergency evacuation notes. For those present in the meeting room, if the fire alarm sounds, please leave the building to the nearest exit. Make your way to the fire assembly point in the car park. The agenda papers and other relevant information for this meeting are available for public viewing on the Herefordshire Council website. The Council is streaming this meeting live on the Herefordshire Council YouTube channel and is making a recording. For participants in the room, please use the microphones to speak, pressing the button on the right of the unit, and speak directly into the microphone. Please ensure that mobile phones, laptops and other devices are turned to silent. Others are permitted to film and photograph and record public meetings, providing that it does not disrupt the business of the meeting. If there are any members of the public present who do not wish to be filmed or photographed, please raise your hand now so that any such person filming or photographing may be made aware. Thank you. Only committee members present in the room may vote during the meeting, and we have a number of people in attendance as virtual participants. Can I request that they use the raise hand feature within the system if they wish to contribute and introduce themselves when they are called upon? So, if we go to, what I would request is that we move agenda item 7 back so that we can actually have agenda item 8, which is the report from the Children's Services Commissioner in Herefordshire. If we could have that as the first item for consideration, please. Is everybody in agreement with that? Thank you. So the first point I would like to ask is, do we have any apologies for absence? We have had some, I can see here, sorry. Apologies for absence being received from co-opted members Anna Eccleston, who's the parent governor and primary co-optee, and Sam Pradley, the Diocese of Herefordshire. Is anyone aware of any other apologies from members of the committee? Thank you. And so no substitutes have been identified either. Do any members wish to declare any interest in any agenda item? No. Thank you. So the minutes document of the meeting held on the 14th of November 2023 is included in the agenda at pages 9 to 16. No matters of accuracy have been notified to the monitoring officer. Is everyone content that I sign the minutes as an accurate record? Yes. Thank you. Do that. Right. Now, public questions. A question has been received from a member of the public, Ms. Reid, and a response has been published in the supplement to the agenda. The questioner has the opportunity to submit a written supplementary question or to join the meeting to ask their supplementary question. A supplementary question must be a question and not a statement, and must arise directly out of the original question or the reply, and must not take longer than a minute to ask. I understand that Ms. Reid is present in the room in order to ask a supplementary question. Thank you, Ms. Reid, for your question. Can I just ask, is your supplementary question, is it in relation to the previous question asked, or is it in relation to a different matter?
It's in relation to the public question, the original public question.
Okay, thank you very much. Would you like to ask your question?
You can see that, quote, parental and carer feedback is primarily gathered by the allocated practitioner, but also by others working with the family, such as supervising social workers, family support workers, independent reviewing officers, or child protection conference chairs, unquote. I understand that all of them are employed by Herefordshire Council and therefore may not be regarded as independent. Parents may be reluctant to complain because of the imbalance of power, etc. Therefore, I urge you to, as soon as possible, carry out a well thought out survey of parents and carers who are and have been involved with Herefordshire Children's Services. Please disclose details about the parent group. For example, does it include parents whose child is or was A, in care, B, a child in need, C, on a child protection plan?
Thank you for your question, Ms Reid, and that's, I think, a very important point raised about how we interact with parents and carers. Do we have a response?
Thank you, Chair. Thank you, Ms Reid, for your question. So we will provide a written response because there were a number of legs to the question, but just an immediate response. In our reply, we gave a commitment to consider the value of surveying. It's not in the written answer, in fairness, but should be borne in mind, of course, that we do commission advocacy services to support families in those processes. And in terms of the question about the parents group, it does include families of those categories identified by Ms Reid, but we will provide a lengthier written response.
Thank you. And I think certainly that this is going to be one of the issues that sort of comes up a lot, is about how we engage and get the feedback about the service. So I think that this is watch this space here as well. So thank you very much. No questions have been received from councillors on this occasion. So if we move to agenda item 8, which is the report on the Children's Services Commissioner, report of the Children's Services Commissioner in Herefordshire. And I believe that we have Elena Brazil online. Thank you very much for joining us. And I assume that everybody has actually read the report. So if you would like to sort of give a roundup before we look at the questions, thank you.
Thank you. First of all, can I check you can hear me?
Yes, we can hear you. Thank you.
Okay, you're never quite sure when you're sat a long way away. My apologies for not being able to be in Hereford in person, but this is the next best thing. As you've said, Chair, the report is included in the papers, and I'm sure members of the committee will have read them, and also the covering report provided by the Director. You will all recall that I was appointed in August last, well, it's the previous year now, 2022, following the Ofsted inspection. And my first task was to review capacity and capability of the council to improve services in a timely way. Following that review, my report was published with a number of recommendations, and this recent report is 6 months on. It's slightly more than 6 months on because the report was completed at the beginning of December, but I wanted to allow time for the third Ofsted monitoring visit to have taken place and to be another aspect of evidence to inform my review. You will have seen, I'm sure, in the report that I have given my view about progress against each of my recommendations, and whilst in the report itself I talk about the pace of improvement and the wish of all of us for that to be speeded up, it is fair to say that in some aspects of the service we have definitely seen improvement. In other areas there is a lot more still to be done. The partnership with Leeds was developed shortly after my review and is funded by the Department for Education. Is an 18-month programme that started around June with some early sessions for leadership, staff and for partners as well. And the primary aim of the Leeds partnership is to help improve the quality of practice, and particularly, and this is very relevant to the question from Ms. Reid, particularly to improve the way in which children's social care and partners work more proactively, more positively with families. You will recall, because you've heard at this committee about the Commission to Listen to Families, which took place in March, April time, and the report was published in June, and raised a number of issues about the approach to supporting families and help families to understand what would be important for them to do differently to look after their children better. But there was clearly evidence and views from families that the experience they had had was not positive as it should have been. And the partnership with Leeds is very much designed to address the culture of working with families and to support staff to understand how to do that better. I won't go through any of the detail of the report because I'm very happy to answer questions, but I would draw your attention to item 14 on the covering report, which is looking forward what I would expect to see delivered by the Council with its partners over the next 6 months. And those will be reviewed in terms of progress in June of this year. One of the important things to note is it says in the covering report that these points have all been discussed with the Children's Services Leadership Team, which is absolutely the case, but they've also been to the Improvement Board, which of course is multi-agency. And the role of the partnership, and particularly the safeguarding partnership, is very key in helping children's services improve the support given to families and outcomes for children. One of the things that I know you, Chair, will want to consider is where the Scrutiny Committee should focus over the next 6 months. And we have discussed the importance of aligning the work of Scrutiny to the work of the Improvement Board, and indeed not duplicating aspects of service delivery which are considered at the Improvement Board, but focusing very much on the areas that might not be considered in detail at the board. And I would suggest you, I imagine, will very much want to look at the feedback area, the first point that I've made about increasing parent and children's satisfaction and involvement in service developments, and hearing back from officers how that's progressing. It may well be the case, and I'm sure you want to hear from the Director his view about how the work of Scrutiny can align with the Improvement Board, but I would also suggest you might wish to look at the development of locality arrangements and multi-agency working, which is not a direct focus of the Improvement Board, but linked to aspects of practice that they are looking at. So I think I'll stop there because that will allow members to ask questions. Thank you.
Thank you very much. With regard to the issue about locality arrangements, where you've pointed out that you want to see locality arrangements developed and implemented with increased evidence of local early help, multi-agency working linked to locally responsive social care. I just wonder what ideally what good locality arrangements look like elsewhere. What are you envisaging when you're hoping for some improvements in this area?
Well, one of the benefits of working with Leeds is they have very well formed and long standing locality arrangements, and you might wish to hear a presentation from some of the people from Leeds who are working with Herefordshire about how they deliver that kind of locally based multi-agency support to families and what Herefordshire can aspire to. Putting it simply, we often call it the right help at the right time in the right place, but clarity for families about how they can access support when they first begin to feel that they're facing challenges that they need help with. And often for families, as you'll know, where their children are either in nursery provision or in schools, that they may raise that with the nursery or the school. And the school will then try and either help the families themselves or refer to children's services through the MASH. Locally based arrangements would simplify access for parents so they don't get pushed from one agency to another agency, but the agencies have an arrangement where whichever individual families have gone to for help, or where a professional has identified the need for it, they can have a multi-agency discussion about who is best placed to help and support that family without complicated referral forms and thresholds and those kind of issues. And also it should be a way in which the statutory services can work more effectively with the voluntary and community services, which at the moment are separate in terms of access. But Daryl or Vicky indeed might want to add to that.
Thank you very much. I think that this committee has picked up the issue of early help and the absolute necessity of it, and this ties in very much directly with that. So I wonder if we could go to the director. Good afternoon. Would you like to respond to the issue of locality arrangements and how we're looking to improve them in Herefordshire?
Of course. Good afternoon. So one of the things that we've been very mindful of not doing over the last 18 months as we were kind of stabilising the service and focused on practice was to do a service reorganisation. So moving the deck chairs around, as it were, when you've got other crises to deal with was important to us. Now's absolutely the right time, both in terms of the context of our improvement activity, our work with Leeds, our work with Eleanor and others, to fundamentally shift the way that we work in the way that we're organised and the way that we interface with families. So our proposal is that we, during the course of the next 6 months or so, start to make that transition and we start to move towards a more locality or place-based way of working. So currently, if I describe briefly the current situation, if a family needs help or is referred, then that comes into the MASH and it is the family's circumstance and case is allocated to an assessment team. If you work in the assessment team, currently if you're a social worker in the assessment team, you could work with families in the north, the south, the east and the west of the county, which means you can spend a significant amount of time just travelling around the county for a start and in your car, rather than necessarily and more helpfully doing direct work with children and families. So to have a workload and a group of families that you're working with that are in a smaller geographic space has considerable advantages to the improvement and quality of practice, but also in time that workers have got to build a relationship with those same families. The other significant advantage is then that if you were a social worker and you were working with a group of families in a specific geographic location, you know, and you could pick any one of our market towns as an example, then you also have the ability and greater capacity to build relationships with other agencies and other professionals. So, for example, you could then capitalise on relationships with the local primary schools, which are also we're working with to build and develop early help hubs, and work with our universal and community healthcare services, so that you can build links around schools, around health centres, around community voluntary and faith sector and other organisations. We've already started to have conversations with some of those schools, with our colleagues in health services, and with the community voluntary and faith sectors. So there's a real win for us in terms of time and availability to build relationships with families and working in that restorative way, which again is part of the work that we're doing with Leeds Children's Services. But the ability to start to co-locate services, perhaps using some of our primary schools as community hubs and early help hubs, but also to think about how we work differently with our community policing teams and community health services. So that's where we want to go. We're thinking about, well, we're not more than thinking about it, we're doing the data analysis now. Herefordshire has worked in that way before, and has moved away from that at some point in the past. There used to be a split, with Hereford being split in two parts, north and south, and then other localities. What I don't see us happening is locality teams, as in a group of social workers based in a specific area. We just don't have the offices, and there's not a need to do that particularly. But if you know that you're working with a group of 15 families, all of whom are around, for example, Leominster, then you can plan your working week in such a way that you're visiting those families in a certain way, dropping in at the school. If you're a head teacher, you've got the advantage then you know which team manager and social workers are working in your area, and you can contact them and have case discussions and the like. So significant advantages. Ellen has expanded on some of those. It has huge potential for us in terms of tackling some of the rurality and social isolation that we experience and face with families in Herefordshire. So really exciting. It needs to be done in a needs to be done with pace. I think that's absolutely a theme that comes through from a number of reports and commentators at the minute, but it also needs to be done well and done carefully, so that we make sure that families do get the benefit that we expect them to see, and that we can plan our workload accordingly. So at the minute we're doing some analysis around where contacts and referrals have come from over the last year in terms of postcode and the like, so that we make sure that when we allocate localities or allocate resources to localities, that we get that right.
Thank you. I think the one of the key things probably is the multi-agency working as well, and we have actually got some of the partners here, I think, from health and the police, and I think it would be helpful just to hear from them as well in terms of the buy-in in terms of this, because it's obviously it's got to be a collaborative approach. So and it also relies on knowing our families well, which I think comes back to the first point about, you know, getting the feedback from the families, which we'll come to, and the engagement with schools, which I know has come up through the partnership, is absolutely key to this.
Yeah, and I won't speak for the partners in the room. Just to be fair to the partners in the room, they're here for a different agenda item completely, and it's not necessarily the same people that in the room that we're talking to about the locality working, but they'll be able to talk, I'm sure, in principle about the benefits to each of our organisations on that. Yeah.
That's fine, thank you. And if any partners feel that they want to respond on this issue, then please do just raise your hand. And yes. Yes.
So just to highlight really, so I'm part of the ICB, so I'm head of safeguarding and designated nurse. So we don't commission school nurses and health visitors, for example, that's public health, but they do sit with our local provider, Wye Valley NHS Trust, and we've already had many discussions around their already locality work, and they've been doing that for some years now. So there have already been discussions around their hubs and that working, and for them it's definitely an improvement to be working with direct social workers as opposed to lots of different social workers. And then also you have the GP element as well, which is very obviously hub-based as well. You know, they're in the communities, etc. And certainly some conversations with Dr. Mike Hearn, etc. There's a real positive there and a real appetite to take that on board and to be part of that. So real positives from a health perspective, definitely.
Thank you, Heather. And
I'm very similar perspective from police. Obviously, elements of our workforce, namely the safer neighbourhood teams, are already very much place-based. So we have staff working out of the market towns and other areas who are focused already on that specific piece of geography, have really strong links in with their schools, with their community, voluntary sector links, you know, and with other agencies that have a footprint in that area. So it's a model that we could link in with through our safe neighbourhood officers very, very easily, and I can see it being really effective.
yeah, thank you. And I think one of the important thing is also getting the commissioners within the different agencies to actually make sure that they're speaking together as well, so that the services are joined up, that the commissioning is joined up, and that the need is also, the identified need is joined up. So I think that that's going to be a crucial part of the locality working. We've got a question, Councillor Kenyon. Do you have a question? Is this question specifically around locality working?
No.
Okay, thank you.
Thank you, Chair. Just picking up what Eleanor said, really, about getting who reports to who and how, and it's a big trust thing. If your child's going to a nursery, at what stage does a nursery teacher say, I think I need to get, you know, the social service involved, or schools? It's a big trust thing, and I think if I do something here, we're going to lose that trust. And so it's very difficult. I'm more concerned about what we don't know about than what we do know about. Am I making sense to you there? If there's some way we could build trust and people know, actually, the council's here to help you, not take your child away, because that's straight away, as a parent, they think you're going to take your child away. I don't want any help. I can do it myself. I know what's best for my children. So if there was some sort of thing that they could do to build that trust and say, actually, we just want to help you to help your children and benefit your children, make it better for your children. And so that's picking up what Ellen said. I think it's a very difficult thing we need to do. We had discussions about pastoral care before. I'm not going to go there again, but it's all linked in with this and how we get children and parents to trust us. That's the biggest thing. And I'm really pleased that it's come to this meeting today. I'm also pleased that we've got an improvement group, because it almost gets double marked or triple marked. So everybody's looking at it, which is great. And everyone can come from a different perspective. But I wouldn't want to sit on this too much, because we're fortunate and we've got an improvement group that does basically just this. So that's my thoughts. Thank you, Chair.
Thank you, Councillor Kenyon. And obviously what you're referring to also is the issue around the increased parent and children satisfaction and involvement in service developments, which will come to sort of after we've just covered this issue around locality. Councillor Harvey, did you have a question?
Yes, I did. Thank you, Chair. I think we touched on it maybe at the last committee meeting when we kind of bumped into what sounded like early help, meaning something very specific in terms of what social workers did, as opposed to the kind of preventative, very first kind of support, engagement, assistance type activity that may be what the locality working is going to be all about. And if there is something that is very specific in terms of early help, once social workers are involved and families are, you know, are in the system, as opposed to wobbling on the edge of the system or just feeling that they're encountering problems and don't know who to turn to. I think it would be important that we actually use a different term, or we clarify what those differences are, so that we're talking about the same thing when we talk about whatever it is we're going to call the very early kind of supportive stuff that doesn't necessarily have you with a case file.
There's a number of issues in there. So early help typically isn't done by children's social workers, and obviously you're right, and we've talked about that in the past. Early help and prevention should be done by a wide range of agencies, and both statutory agencies and community, voluntary, faith sector and communities. So the stronger the early help arrangements are in Herefordshire, and it's something that Eleanor and I have spoken about on a number of occasions, then the better for children and families in Herefordshire generally, and also to prevent families escalating into a higher level of need where a social worker is required. The council children's services run targeted early help services through our early help teams, and that's where a kind of a particular level of need, and our services do that very well. And then, of course, there's a movement between early help services and social care intervention, both up and down in terms of levels of need and levels of support. The locality working that we're describing is primarily about how we reconfigure our social care services, but we are absolutely mindful to make sure that we maximise our opportunity to strengthen the relationship with a wide range of early help arrangements and services in each of those locality areas. So much of the early help activity that goes on in this county is not done by Herefordshire Council and not done by Herefordshire Children's Services. It's done by a wide range of organisations, some in health and others. So there is a real opportunity here, as I said earlier, to maximise those relationships and to strengthen those, and particularly to coordinate some of those around our primary schools, and there's a lot of evidence that in other areas that's worked really well, using our primary schools as early help hubs, as we're doing that in terms of autism hubs and other stuff as well. So you're right that there's something about language and how we describe services, and we should work on that so that we make sure that we're all clear what it is that we're talking about at different points. But typically, social workers get involved at a level of need where a threshold has been met and some kind of statutory assessment and intervention is required. Early help services are somewhat different, but we've spoken in the past at Scrutiny Committee. It's in the interests of children and families in Herefordshire, and of course of this service and other services, that we strengthen our early help arrangements so that families get, and it's possibly an overused phrase at times, but the right help at the right time. What we want to do is families to be able to either go online or go into their local school or health centre or library or other settings and get information about whether it's parenting support or other issues that might be going on for their families, without the need to either refer to a statutory service or indeed without those needs to escalate to the point where a statutory service has to get involved.
Thank you. I mean, it's heartening to hear you saying that there's an assessment going on about what the capacity on the ground is and how it's spread geographically. It's good to hear that you say this is something that needs to be done at pace. But sometimes, I mean, I think we found that everybody has been frustrated that things don't happen as quickly as, everybody wants them to. And I'm just wondering if you could maybe give some indication of what at pace means and what you expect to be the timescale within which we'll start to solidify what the approach is that we're going to take to this.
So the data analysis is ongoing at the moment. I expect that at the beginning of April we will start to allocate new referrals by postcode, so that then if you're a social worker in one of the assessment teams, you'll have a cluster of families working in a particular area. That's relatively easy to achieve, notwithstanding that there's quite a lot of data crunching to do to make sure we get that right. Of course, you could say, I could say, as of a certain date, 1st of April, 1st of May, whatever, all families, it will be done by that way. But what we've got to appreciate is there are a significant number of families who have a relationship with a social worker at the minute. Obviously, we do hear at this committee and in other forums that that's not the case for all families. Some families experience changes of social worker more often than I would like and that you would like. But in fact, there's a significant proportion of families who have a relationship with a social worker. What I need to make sure that we do is we start to move into that locality model. We don't disrupt those existing relationships. So there will be transition points when either our intervention ends and then that social worker's caseload can be more focused on a locality. So the allocation of new assessments should be able to start in April. That's the plan at the moment, and we can start to reconfigure and realign some of our teams to postcode areas and localities. And although we can start to configure workers and teams in that way, what I don't want to do is reconfigure all of their caseloads overnight, because that will mean we force changes on social worker on a wide number of families that is completely unnecessary. So there will necessarily be a period of transition. And until we've got to the point where we've decided it's this locality split in this way by the area, then I can't say for sure which social workers that affects, because it may well be that there's a social worker, quite by coincidence under the old system, has the majority of their caseload around Hereford anyway, so they become part of the Hereford locality teams. So until we've done the final number crunching, I can't accurately predict how long it will take from beginning to end to make the transition. But the initial allocations of work will start to transition in April.
Thank you. For me, it sounds a little bit like that. It doesn't feel like that's the pace that sort of being anticipated in terms of early help, multi-agency working. That it feels like we could be putting that in place now to avoid any further children needing to engage with social work. And I think that that's key in terms of utilising the provision that we've got with early help providers at the moment in the county. Am I misunderstanding something? I
think the question I was asked was about how we move the social care teams into locality, and I've answered that in that context. That's your question suggests that we're starting from a position of zero activity. There is a huge amount of work that we've been doing over the last year to develop our early help arrangements, to work with our partners. We've had a number of really helpful and useful summits with colleagues across, for example, Wye Valley Trust and the ICB, to start to think about how we align those services. We've got more shared and pooled resources around some of the initiatives. We've gone out, myself and the Service Director for Education, and met a number of primary school head teachers and started to make arrangements about how we use some of the space in primary schools. So there's a lot of work going on all at the same time. The specific question I was answering was about how I organise the social work resource alongside that. And then as we are able to do that, that nicely falls in place with the work that we're doing with schools and early help services and the community voluntary and faith sector. Okay, thank you. Eleanor, did you have a comment you wanted to make? You had your hand up.
I did. I think Daryl's partly said it, but what I'm looking for is arrangements which are easily accessed by families, well understood by both families and agencies, and where you can see that there is a mechanism for deciding who is the best placed professional and agency to support the family, maybe pulling in some specialist advice and knowledge as well alongside that. That's one element of what works better for families. The other element is what Daryl was talking about, which is making sure that children's social care is well aligned with those arrangements as well. And I think you need to be looking at both at the same time, and it's good to hear from Heather and Helen about the willingness and readiness of health and the police to engage with developing those arrangements. And I suggest that there's no reason why you couldn't think about, well, what does that mean in terms of milestones and timetable to improve the way things are at the moment.
Okay, thank you very much. I think it would be really important for the committee to actually get some feedback on that, possibly a report on what progress has been made in terms of both of those two streams of work, and how partners are sort of being engaged with to be able to operate in that way as well, because it sounds like they are willing and ready, and that basically that an element of that piece of work can be put in place almost immediately. Councillor Davis, you had a question, and then Councillor Proctor.
Yes, thank you. Darren, I just wanted to ask about the Hope Centre in Bromyard. Is that still seen as a locality area for the groups to meet? Do you know what I mean?
I do know where you mean. So the Hope Centre provides some services for us, and along with Talk Community Hubs and other children's centre services, is absolutely part of that locality arrangement. You're probably aware that there's an ongoing tender at the moment, so I can't really comment more specifically about the Hope Centre at the moment, because there's a tender process, and it'd be inappropriate for me to comment on that particular arrangement.
Yes, can I just say that parents are very concerned that they're going to lose quite a few of the facilities, so I just thought I would mention it. Thank you.
Noted, and again, there's no decision made on the tendering process at the moment. But
thank you.
Yeah.
Councillor Proctor.
I'd like to link this stuff about localities with I guess the target around parent and children satisfaction and involvement. So you've just been describing what's obviously a very significant service development. So how have children and families been involved so far, and how will they be involved in the future in that?
So children have been involved certainly through as a restricted group at the minute, in terms of children care, and care leavers have been directly involved in some of the thinking and work on that. And then we're planning at the moment with our new parents and families group how we can involve a wider group of children and young people in that consultation and piece of work. But until we've met with a group of families so far. One of my service directors met with a group of families a couple of weeks ago, and the broad proposal to move to a more locality way of working was well received. Clearly, families will want to know more information about that, just in the same way that Scrutiny Committee does. And it kind of links to the public question we had earlier on. What we need to do is, once we've got a clear set of proposals, is we need to start sharing that more widely and ask for people's views. And likewise, then, whether it's through a survey or a range of other different types of activity, we clearly need to demonstrate over a period of time that degree of satisfaction in surveys, in our services rather, not just about the issue of how services are located, but actually, did they receive a good service, and how did we treat people, with respect, for example.
So that all sounded sensible, but it's what I would describe as consultation, and to me the word involvement means something a bit more sort of fundamental about having a stake in the design. Did you just not mention that?
No, but at this stage, so part of the work, the conversation we had with that group of families the other week was about that collaboration. What do you think? And they fed back some ideas and thoughts there. Ultimately, this is simply about how we allocate work, because teams will largely still be based, and workers will largely be based at Plough Lane. What we're not doing is saying, I'm going to have a team of social workers or three teams of social workers based over there, because we don't have the area offices anymore. So ultimately, this is about workers mostly being based here at Plough Lane, but having workloads and cases that are postcode located. So then you'll go out for a day or 3 days a week, or whatever proportion of your week, and you might be hot desking from the school or from the health centre or from a range of other services. So, and then what we deliver isn't up for negotiation in terms of the core business, because it's a statutory intervention. So There are what we want to do, as much as we've done very successfully this year in the SEND space, is more collaboration with families. So in terms of thinking about one of the things we want to do over the next 18 months particularly, but starting the conversation this year, is how do we move to a child-friendly Herefordshire model. So that's a partnership conversation, but that partnership includes families. And again, we've done some good work with Parent Care and Voice and others in terms of collaboration. So there are parts of that reorganisation or that future visioning that we absolutely want to collaborate on. There's less opportunity to do that in the way of us just simply allocating workflow and workload, which is a lot of the locality stuff. Councillor Powell and myself have started a conversation last week, particularly with the Children and Young People's Partnership around child-friendly Herefordshire, and we were very clear that we want to go out and work with families and communities about what that would look like. It's not our vision of a child-friendly Herefordshire. It's got to be Herefordshire's vision of a child-friendly Herefordshire.
Thank you. Councillor Highfield, I would quite like to move us onto this point about parent and children participation. And is your question around that?
Well, it's related to what's been said, and I wanted to quickly follow up with a question, follow up what Jim Kenyon said. One of our problems is that it's natural for a family that's got problems to be reluctant to seek help. Privacy, fear, trust. And how do we manage our, if you like, publicity? Do we work at making sure people can source information, particularly anonymously, so that, because they may be ashamed or frightened to go and approach the school or somebody else? Do we have some specific system of trying to make sure that the information is available to people?
We do. But I'd say that it's not just a Herefordshire Council responsibility. So I think that provision of early help and prevention, and those early help prevention arrangements are very much a partnership responsibility. So we have a responsibility to deliver part of that arrangement, and then the wider partnership has others. So we have websites, for example, like Talk Community. If you go on to the Wye Valley Trust website, the police website, other websites, there's a whole range of different information. It's not all in one place. You and I guess, and many families these days would go into a search engine and have a look, whether it's about parenting support or other stuff. If I think just about, so there's something about how each of the agencies in the partnership keeps that information up to date and makes it more accessible. Technology is improving rapidly so that access is available to more families through a greater range of devices. We as a council are looking at the moment at our external website as an example, and I'm sure other agencies are doing the same, to make sure that it's accessible to a wider group of people, but also that, in fact, if you wanted to go to our website, for example, and say, I want information on this, you don't have to click multiple times to get to that information. And I think our website is somewhat clunky in places, and certainly the children's information is. We're looking at that at the moment to make that easier to use. And then, and again, schools are a good source of information for families as well. So there's a lot more that we need to do, and what we won't do is produce one website, because that would just be incredibly expensive to set up and very expensive to maintain, and almost as soon as you think you've got it up to date, somebody else's information has changed along the way. What we are trying to do is use social media platforms like X and Facebook and other platforms to make sure that we get more information out. So a common strategy around early help and prevention. And again, we mentioned one of the children's centres earlier on. They're particularly good. They've got a really good presence on social media and stuff like that. So we're trying to learn from families about how they access information, and then make sure we can to develop the information that's available to them. But we've still got a long way to go. But I suspect that would be the same for almost any of the agencies that might come and speak to the committee at some point. Trying to stay abreast of technology and sharing information is a huge challenge for us, as it changes almost daily at the moment.
Yeah, well, my question was partly driven by the fact that you're right. The Herefordshire Council website is clunky. if you type in CEO in the search engine, you get about 20 hits, and none of them refer to our CEO. So if we're going to have people able to access information, perhaps you'd better put the Understanding Herefordshire team on it, because their website is brilliant.
There are some good examples of different websites, certainly, that we were looking at and other people should be doing as well. Yeah.
Thank you. Councillor Harvey, you've got a question. Is it relating to the involvement of parent and children in service developments? Have you? Because I would quite like to move on to that topic. If it's not, if you could ask a question, then we'll move just on to this issue of how we involve parents and children in developing the service.
Okay, yeah, I mean, mine was more of a question about the range of things that we're using to monitor and to track progress. The Commissioner's report's really helpful in highlighting where specifically improvements are being sought, and there's an appendix to the report which identifies where progress is being made, or where particular things have already been achieved that were requested in the previous report. The covering report that has come to us today, as the Commissioner's highlighted at paragraph 14, is identifying the additional things that are being proposed to be looked at specifically over the next 6 months. And I'm just wanting to check that we've actually got some sort of a dashboard, or we've got a way of organising and collating the information that is evidence supporting progress being made in this increasing list of areas that need to be covered. I'm a great sort of fan of the, sort of red, amber, green, and, sort of various colours in between to sort of indicate progress being made. And I do recognise that there is a lot of work that needs to happen before you actually start to see numbers changing. And that doesn't, if numbers aren't changing, it doesn't necessarily mean that progress isn't being made towards that. It's just if it's the numbers that we're wanting to see change, there's going to be a big pause before that happens. So two questions: have we got something which is building in terms of a dashboard that covers specifically the areas that the Commissioner is identifying that she's wanting us to demonstrate and provide evidence on improving? And are we taking a dashboard approach to that to make it easy and quick to see where we need to maybe dive into the detail? And if not, what is the approach that we are taking?
So you're quite right that there are some real positives about having dashboards, as well as some potential limitations. So the Commissioner has given us, has worked with us to develop a set of indicators that where you would expect to see a further evidence of progress over the 6 months, but has, I think, cautiously and carefully avoided putting a specific number on many of these, because the Commissioner and the DFE and Ofsted are not looking for a specific number against most of these things. They're looking for a trajectory of improvement and signs of improvement. So, but we will, with my management team and with some of our partners, we will apply some internal metrics to some of these in terms of, I'd expect to see some milestones achieved along the way. And for example, on the third point there, it's about reduction in child protection numbers. I know, based on our current performance monitoring, that there are just over 30 fewer children on child protection plans this week than there were at the beginning of December. I also know that there are fewer Herefordshire children in our care now than they were a year ago, and so on like that. There's a number of indicators we can use. There are a wide range of existing performance reports and dashboards. So where the points indicate a reduction in a number or an increase in a number, then most of those are covered by existing dashboards. And for the purposes of keeping scrutiny, this scrutiny committee and indeed cabinet up to date, we will need to pull those together as a bespoke kind of narrative report at the end of each month, which is something that Councillor Powell and I have indicated that we would want to do to make sure we keep members, rather than create a bespoke one which duplicates other dashboards and reports that we've got in place. There are other indicators in the recommendations that it's hard to put a number on. So improved joint working with partners evidenced by successful joint commissioning. Again, that's not a dashboard, so that's a narrative and evidence from our partners as much as it is from us. So we will come back with a kind of a hybrid approach. There are some existing dashboards which clearly should indicate progress and improvement against some of the points that are highlighted in paragraph 14, and others will need to be a narrative report. But what we have learnt from the first 6 months and feedback from Children's Scrutiny and from the Improvement Board and from Cabinet is that members would like to be kept more up to date more frequently, and that's something that Councillor Powell and I have committed to do.
Yes, thank you, Mr. Crompton.
Chair, just relevant to the pace. I mean, we've done a report going to the next Improvement Board, trying to identify those things that have helped change and those things that need to be addressed to get more pace. So there's a lot of work going on within the partnership, and indeed in Dal's service, I'm sure, which is trying to work out what helps us move faster and what holds us back. And of course, there are some things that take time. So some of the work in the partnership is dependent on systems changing. IT systems, that takes time. Some of it's dependent on leadership. Where that's the case, we can address it. So I think there is a great deal of thought now within the partnership of how we move things forward at a greater pace.
Thank you. Councillor Harvey.
Yes, I mean, thank you for that explanation, and you know the example of joint commissioning with partners. I think the first, yes, I recognise that might need to be a narrative rather than a dashboard, but you can red, amber, green what progress you're making in achieving that, and if it's a case of identifying where you are individually wanting to commission work that could be combined to jointly commission things, there are going to be some steps along the way in terms of moving towards joint commissioning that can be identified as points that indicate progress in achieving that. So I take your point, there is a narrative there, but it doesn't mean that you can't red, amber, green it in terms of whether you're making progress on that. Now, Chair, you were wanting to talk specifically about increased parent and children satisfaction. And I note that the suggestion that's been made and agreed with the leadership team is, exampling increased proportion of complaints being resolved at stage 1, fewer stage 2 complaints, and receiving feedback from parents and children. Well, clearly there's a narrative element to that, but there's also a countable element to that in terms of numbers of complaints at particular stages. We haven't been great at dealing with complaints quickly. Now, I recognise that complaints can quite often be very complex, and I'm just wondering whether there's something about the council's standard complaints process which, do children's complaints follow those, or is there a specific complaints process for children? And what is it that is, where are we now in terms of resolving complaints at those stages? And what sort of progress would you want to see those numbers reducing in terms of stage 2 complaints?
So I'll just briefly go back to so I think ultimately we were strongly agreeing with each other that some kind of dashboard or narrative report is needed, and yes, some kind of RAG rating. What we clearly want is transparency about us making progress, as I'm confident we will against each of the 6 areas that have been identified with the Commissioner. In terms of complaints, the vast majority of complaints that relate to children's services, particularly if it's an open case, i.e. a family that we're currently involved in, then they all fall within the statutory children's complaints process. which is, as it includes in the title, it's laid down by legislation and we have to follow a particular process. That's 3 stages, and then with recourse to the local government ombudsman too. At some point in the year, and if it's in the committee's work plan, we can bring a report on the year's complaints, because our complaints team produce a report, and we can bring that later in the work programme if that is acceptable to the committee. But what we are seeing already and have seen over the last 6 months is a reduction in the number of complaints that children's services are receiving, and an increase in the number of compliments that we receive, because we now capture compliments as well, and we do get them. We see more resolution at stage 1 and stage 2. Previously, we were getting a lot of complaints where we weren't resolving them at stage 1, stage 2, they were going to stage 3. There's still more to do, you're right, some of them are very complex and take time to resolve. We're spending a lot more time talking with families and trying to resolve their complaint at an early stage to their satisfaction. We don't always get that right. We're working hard on that though, and we have a very, very good, in my view, complaints team which doesn't sit within my service. It sits elsewhere in the council, and they produce weekly reports for us. They work really hard to advocate and work with families, and they keep me and my team on our point in terms of making sure that there is minimal drift and delay when it comes to working with complaints. So I think there's an improving picture there. In an ideal world, I'd like to see a world where we just don't get complaints and everybody's wonderfully happy about children's and are rushing to send in compliments. We're not quite there yet, but I'm hopeful.
I think the more opportunity we give people to give us feedback, the less chance there is of something stewing to a point where people make a formal complaint. So do we ask parents, or regularly, families, children, to give us the, how are we doing? How are you feeling right now? What are your worries or concerns? Do you understand what's happening next? Do we do that as a matter of course?
We're starting to do that more so now. Again, when I got here, there was next to none of that going on as a routine. Now when we do case audits, the auditor is supposed to speak with the family and or the child, depending on the age and understanding of the child, to get feedback on how we're doing. And we're currently building systems so that when we finish key pieces of work, whether it be perhaps an assessment or for example, when we finish our intervention with the family, we kind of get that customer satisfaction view at the end of that process as well. And of course, our independent reviewing officers and child protection conference chairs, they meet with families as part of the work that they do and seek feedback. And that's fed back to my DLT and to service director through the IROs and CP chairs. It is not yet as methodical or as well used as I'd want it to be. We started from a very low base, but we're slowly building that. And some of that's about better using technology in the systems we've got. Some of that is about, as the question that we heard earlier on, about making sure that we build trust. And some of that is making sure we stabilise the service and build relationships.
Okay, I mean, I don't think we can do too much of this. I mean, when we're standing, when we go to the airport, we come out of the loos. When we go to the tills at the supermarket, we get a smiley face, a grumpy face, a sort of a concerned face, that we can sort of bop on a touch panel as we're standing there. And it's a facetious example, but and most people don't bother to hit those buttons, but they're there and you can hit them if you want to. So having the opportunity to do that without even there being a particular point in a process, but it's always a door that's ajar, gives us the opportunity to receive feedback at any point. Is there anything like that is being, sort of thought about just to, keep that door ajar?
There's a number of things that we're thinking about at the moment in terms of how we use technology, social media platforms, online surveys and forms. So yeah, that's in our thinking at the minute. It's again, we've started from a low base there. But don't forget, we do get feedback from a number of families. For example, we had the commission listen to families last year. We have the complaints process and other stuff. And what I'm particularly keen that we do is we open all of that up to more families. So it is quite right that when a family is unhappy with children's services, then they are able to make a complaint, and families do. We also don't hear from the vast majority of families that we work with. So the vast majority of the families where we're supporting children families, we don't hear from them at all in terms of either a complaint or a compliment. And there's something about making sure we put in place systems so that I don't assume that the absence of a communication is that people are broadly satisfied with services. So we're trying to create systems that allow all families that we work with, where there's a statutory intervention certainly, to be able to say, you know, I've been treated well, or the situation has improved from the point when I contacted Children's Services to the point when Children's Services stepped away, and the same for early help services. And again, we can learn from some of the work that some of our partners are doing as well.
Thank you, Councillor Harvey. Councillor Proctor, you've got a question. I just wanted to quickly say, and then Councillor Davis, you've got a question, that as Councillor Harvey said, we can't actually do enough of this, and what we need pretty quickly is a forum established where parents and young people can feedback about their interaction with the service. So I feel that there's a recommendation coming here about that, and I know that this is something that the partnership has raised as well, so possibly this will come up through the discussions with the partnership. But Councillor Proctor, your point.
I'd just like to gently challenge the idea that a desirable outcome would be no complaints, because I think it's possible to say that a service that is constantly trying to improve would actively encourage complaints, but they should be almost all resolved at stage one, and those sort of leadership intents seem to be in tension. So either you're trying to embrace complaints as a way of driving improvement, or you're trying to drive out complaints.
Yeah, no, as a clarification, I wasn't suggesting that you just don't want to see complaints. We use the complaints and the data we get from complaints, I think, a lot better now than we used to. I think when I responded earlier on, I said no complaints because everybody was telling us they were more than happy with the service, rather than no feedback at all. I think we're getting better at listening to families. We've still got more to do, certainly we have. And we get and need to get feedback from a wide range of ways. But yes, of course, any customer feedback, if you want to use the word customer in this context, should help to develop services. But I think it was also in the context of a question that you asked about collaboration. So we want to have a different relationship with families. And ideally, if you've got that relationship right, people shouldn't feel that they need to complain. But of course, the system will always be there.
Thank you. Councillor Davis.
Thank you. I wanted to ask about how many calls you get anonymously, or does that not happen these days?
I don't have a number off the top of my head. We do get anonymous calls, or you get communication where the person would like to then remain anonymous if we pick it up and take it forward. So, but I don't have a number, and I'm not sure that we record them in that way in terms of the source. The way we record contacts and referrals is the nature and need that's been identified, or the risk. But yes, I can't imagine we'll be the same as most of our statutory partners. You get anonymous calls, and that doesn't mean you take them any more or less seriously than anything else. We need to look at what the evidence is.
And they're followed up, are they, too? Like you would with an ordinary call with a person's name?
Yes. In that the local authority and all of the statutory partners have a duty to investigate and assess if a safeguarding concern is raised. So if an anonymous referral was made about a safeguarding concern about a family or children, then we would of course have to look at that, and part of the way we do that is triangulate our information with other agencies, and it might be that we ring the family and say, we've had an anonymous call, can we talk to you about that? But yeah, we can't ignore any call, anonymous or otherwise.
Thank you. what's coming clear to me about this discussion actually around the parent and children satisfaction is that we need to develop this piece of work. I think that it's really important that we identify what the issues are for parents and children, and I know that that is something that is across the whole of the partnership really, and that there are ways of doing that. I don't feel that we necessarily have to take this on the council itself, but I would suggest that there probably is a recommendation around here about having a dashboard for the 6 areas of improvement that have been identified by the Commissioner, so that we can actually have a monthly sort of feedback on actually whether there are improvements. What are your thoughts on this, Councillor Harvey?
Well, the way I've read it, and I'm happy to be corrected, is that these are additions to the things that have been previously identified that we're already working to make progress on, that we haven't thrown those away and started on some new things, that we've actually got those and these are added to them. Is that correct?
Some of them, for example, recruitment, it's appeared in both reports. So some of them are a continuation. Others, it was to see from the first report that there was starting to get a trajectory of improvement built, and this builds on them. So some are replaced by these, some of them are alongside. We have a comprehensive improvement plan, and we report on every element of the improvement plan and these recommendations to the improvement board, and happy to do so here as well. But you need to look at the two lots so recruitment, it's a kind of continuation reflecting where we're at on our improvement journey at the moment. There was a recommendation in the previous report which was about reducing the numbers of children coming into our care, which we have done. So there are fewer children coming into our care now. But there's a different focus here in terms of increasing the number of special guardianship orders and the like. So it's not necessarily 6 becomes 12. These are the areas where the Commissioner wants to see specific additional progress or trajectory of improvement in 6 months' time, or less than 6 months' time now, so that she'll be able to prepare her next report for the Minister.
Okay, I mean, for me, I'm very conscious that, you know, as the Commissioner said in her introduction, you know, we're not wanting to duplicate work that's going on in the improvement board or the improvement panel. However, I'm conscious those are, you know, for very obvious reasons, not public meetings, and scrutiny is the place where you know, we acquire assurance on behalf of the public, and our meetings are held publicly. So maybe my question is, how do we acknowledge the progress that is being made and overseen by the improvement board in a public way, and, you know, recognise that through the scrutiny process, while making a useful contribution in addition to that from the point of view of scrutiny? I just kind of want to understand how we make that work that's going on the improvement board accessible to the public and to members more broadly.
Yeah, I think that's a very valid question. I think it's not for me alone to answer that one, so maybe I could suggest that perhaps you know, Chair, Vice Chair meet with the Chair of the Improvement Board and the Scrutiny Officer, and we think about how we do that, and then come back with a proposal. I think there's absolutely some merit in doing that, but it's not for me to commit the Improvement Board, which I don't chair. Obviously, I'm held to account by the Improvement Board, but I think there's a conversation that I'd certainly support us having. Yeah.
Thank you. I think if we can put that as an action, because it is, as you say, it's important, and the improvement board is not held in a public forum as well. And I think that it would be reassuring to see that progress was being made on these particular issues. So if we can put that as an action, Councillor Highfield.
Yeah, I want to say something on that topic, and to maybe I misunderstood the Children's Commissioner. I see she appears to have left us. The work of the Scrutiny Committee is to influence the policies and decisions made by the council and other organisations involved in delivering public services. That will include the Improvement Board. Now, we don't want to duplicate their work, but we're also not going to ignore what they're doing. The Scrutiny Committee should be scrutinising them, and if we think there's a direction that they should take or a suggestion to help them, then we should make it, and not. It appeared that Ms. Brazil was suggesting that we should keep away from that, but I don't think that's the role of the Scrutiny Committee.
I don't think that's so. Eleanor Brazil had made it clear she was only available for an hour. That's why she's had to go. I don't think that's what I didn't. It's not what I heard. I heard a caution against us duplicating the work of. I don't think she's a strong advocate for local government and for a strong scrutiny committee. And yes, the scrutiny committee has a clear role here. But then for each of us, we wouldn't want to be having the same conversation. So scrutinising the impact and having a conversation about the work of the Improvement Board is an absolutely legitimate role for a Children's Scrutiny Committee. But to do the same work would be a bit pointless. I think that was the point she was making.
And I think also the point is that actually there are elements here that the Improvement Board is not focusing on. So if we can incorporate those into some sort of feedback. So if we can work on that. I think the other thing that I wanted to recommend was that we do bring the complaints procedure back to scrutiny, and if we put that sort of on our work programme and actually look at how that procedure works, that would be particularly helpful if everybody's in agreement with that.
I am, but could we include in that not just the complaint procedure, but the way in which people can register their satisfaction or otherwise with the service? It's all part of it, really.
Thank you. Scrutiny Officer.
Yeah, this is quite a multifaceted piece of work because the information comes from a wide variety of sources. So I would suggest as a committee you meet after this meeting separately. You're starting to build a list of ideas to go forward, and I think a bit of time outside of the meeting to have a think about what you want and how to get it would be very useful, I think.
Thank you. So I think we could possibly move on to the next agenda item. If we just look at the recommendations from the covering report, so that the Children and Young People Committee considered the Commission's report, indicate how it might want to be updated on progress in the future, which we've done. We've looked at that, and the Commissioner has suggested areas for inclusion in the committee work programme. So if we record any suggestions and observations, which I think we've captured, and then so it says, does the committee wish to propose any specific recommendations to the executive? I feel that actually what we've identified is a piece of work for us to look at. So we haven't actually got specific recommendations at the moment. So if everybody's happy, we'll move on to the next agenda item, which is the Safeguarding Children's Partnership Annual Report. So we've had a copy of that report. Thank you very much, and some good feedback from Kevin Crompton, who is the independent scrutineer and also currently the chair of the Safeguarding Children's Partnership. If you would like to sort of speak us around the report, okay, please.
So thank you, Chair. I'll briefly introduce the report. I'll take it as read. So I think the first point to make was made in the paper. This covers 22-23. It's nearly 10 months out of date. And as I've tried to intimate in the report, I think things have moved on considerably. And I'll give you a very brief example of that way introduction. I've today looked at the papers for Monday's Quality and Effectiveness subgroup of the partnership. And the agenda is not as it was a year ago. There is performance data on. There's an analysis of partnership participation in reviews, in initial child protection conferences. There's an audit of child sexual abuse cases, and there's a tracking of the response the partnership is making to the Families Commission. And I just thought I'd share that as an example of what I see in terms of what has changed over the last year. There's still a lot more to do, and as the independent scrutineer I would say that. I'm probably the last person to say everything's going well. It's part of the role. But I just wanted to make sure that there's understanding that some of the information here is dated. No, I think it's an honest report. I think it identifies some of the challenges. I think it shows even last year change was happening. And I think it does show the commitment of the partners. I think that's all I say at the moment, Chair. We're happy to take questions. I'm here with partners. Maybe much to talk about. But as I say, if I were writing the report today, there would be a slightly more nuanced statement from the independent scrutineer as to where we are.
Thank you very much. And in your report, you refer to the review and implementation of the neglect strategy, continued improvements in the MASH, adopting a Get Safe model, and the implementation of trauma-informed approach across the partnership. Do you feel that you've made good progress on those specific 4 areas? And, is there any evidence to suggest that there's a positive impact for children, young people, families and their carers in those areas?
If I start with the last point, I think evidencing impact of what the partnership does for children and families is still a challenge. It's not just a challenge here, it's a challenge in other partnerships I've worked with. So that is work in progress. In terms of the areas you mentioned, we report now regularly to the Improvement Board because we have agreement with the Improvement Board of these work streams that the Safeguarding Partnership will try to deliver. And that report gives progress in each one. Briefly, Get Safe is been held up by some systems changes. That's been the barrier. But actually a great deal of work has been done now. In fact, in about a week's time, 30th of January, there'll be the multi-agency launch of the Get Safe approach, which is an improved approach to dealing with cases where we're suspected child exploitation. So that's going well. The improvements in the front door, the MASH project, that's been well documented in Ofsted reports and others. So improvement there is ongoing. I'm trying to go through memory. The area, one interesting area, we are struggling to finalise our neglect strategy. That's the document, the actual thing. But under the interim strategy, there's been a great deal of work around improving the use of the graded profile. And there's been some very good work done on developing training materials which are online using NSPCC materials, and that's been rolled out to a lot of people. So in terms of those 4 areas, some progress is being made. I think there's a new ambition in the partnership and a determination that in the next 12 months, even more will be done to land these particular work streams, which is really refreshing.
Thank you. That is good to hear. In terms of the neglect strategy, as far as I understand, that is going to come to the Scrutiny Committee when it's finalised. So I think that will be one of the items on our work plan. Given that neglect and abuse are sort of one of the key reasons for referrals being made, I think it's really important to understand how the strategy aims to deal with that. I also wanted to ask about the Think Family approach from partners, sort of how the work has progressed on that. And when we last spoke to you, we wanted to hear back about sort of work on the Families Commission as well. But this is obviously a key area within the county, is actually how we take on board the experiences of families, how we hear back from them. And I think that the information that we need in terms of the impact of improvements will actually be, we would gather that information if we had better engagement with families. So specifically on that Think Family approach, and any evidence that we have that can sort of quantify how that is progressing.
I'll leave on the response, but other partners may wish to talk about that. I personally think the Think Family approach is tied up with the introduction of the restorative model across the service, and I'm pleased to report that partners have been engaged in the training, the introduction of that model. So I think, and I certainly think we could get examples from early help of where there's a think family approach, where other partners have been involved if we wanted to get some case studies. But I certainly see, others may comment, but I see that overall new approach that's being developed and that partners are involved is what will eventually deliver a think family approach. And I'm not saying every piece of work here is devoid of think family thinking. I've seen cases in which there is clear evidence of agencies working together for the benefit of children and families. But it's not yet at the level that the perhaps was described in the Families Commission.
Okay, thank you. I think if anybody else has got any comments on this Think Families approach and the work of the Families Commission that you want to raise from the committee, Councillor Harvey.
Yeah. Well, I think my question, I sort of zoomed in when I received your report, and we're always going to get these reports, 9-10 months sort of after the end of the year, because that's, that seems to be how long it takes to put it all together and get it on the agenda. But it wasn't very long ago we were talking about the previous year's report, so it's good to have this report before us while the other one is still relatively fresh in our minds, and it's good to see that there has been real progress made in the 12 months that this report represents compared to the previous year's report that we looked at. But I did scoot straight away to the section of your report looking at the audit subgroup, because I was really pleased to see the work of audit starting to build in the previous year's report. And I was looking forward to seeing commentary around how many of the barriers that were highlighted in the previous report and the difficulties that were being faced by the audit subgroup had been resolved over the last 12 months, and I didn't see it, which cast me into a slough of despond, which I've crawled out of. But I'd really appreciate a little bit of context if you could put that around the words that are in the audit group subsection on page 44 of our agenda pack, because on the face of it, it's not great reading.
So the audit subcommittee was combined with the work of the quality and effectiveness subgroup. I think that's what we're talking about. I'm trying to cast my mind back to a report that I saw just when I arrived. So, and this, yeah. So there has been an improvement. I think one of the most frustrating things right in this report, if we wrote it even in June, there was a great deal of activity done last year, which was about getting the governance structures right. So the audit committee, the quality and effectiveness committee were combined, and the former chair and the current chair of that subgroup are in the room. They may wish to comment. And there has been an improvement in the focus on multi-agency audit. There's been an improvement in the timescale and setting out an annual plan for those audits. That has now happened. And as I say, on Monday's quality and effectiveness subgroup, there is a report back on the audit of about, I think, 6 cases where child sexual abuse was suspected. The group has looked at those cases, done a multi-agency audit, have a multi-agency discussion, and has got some learning recommendations from that are now put into an action plan that will be followed through. And so getting out the annual report of safeguarding boards has always been a challenge wherever I've been. It was a particular challenge here, but you'll be pleased to know that under Working Together 23, that report has to be published by September. So next year's report will be available. September is the absolute deadline, but you never know. With Goodwin, some organisation, we may be getting out earlier. And I would suggest to committee services we talk about scheduling that for your first meeting of beyond September, and we get it to you earlier. I think the other thing I suggest is scrutiny, that there are probably aspects of partnership work that you could take as a specific focus, for example, and track one through for a year. and I'm sure we could provide you with some regular updates on that. So if multi-agency audit was of interest, I could certainly, as independent scrutineer, get a schedule, tell you what's being done, tell you what the learning is, and then you can have a discussion about not just has it been done, but what was the learning from it. So we could, I think, work together to improve your line of sight.
I'd really appreciate that. I mean, for me, being able to audit across multi-agency is the only way we're going to be able to acquire assurance that as to how our partnership is working, as opposed to our individual partners working on their individual bits of the jigsaw puzzle. What I want to do is see the whole picture. And, you know, we can all be busy. There's a difference between being busy and being productive. And I think if partner members are too busy to engage with how we go about, you know, assessing how we're working together as a partnership, that tells me something.
Yes, so I know it's about being busy. I think one observation I would say, and something I'm trying to help with, is part of the being busy is also not having enough time to write up and disseminate and communicate the work that's being done. That is one problem. But I think, to be fair to the partners here, I mean, I've been to the Community Safety Partnership. I chair both the Adults Board, the Children's Board, the Health and Wellbeing Board, the Children and Young People's Partnership. And I think there is capacity challenge for the partners here, because the same people are tasked with working with all those partnerships, and that sometimes can create conflict. What we've tried to do in the Children's Partnership is say, if capacity is tight, what are the priorities, which is why we agreed on 4 priorities rather than a whole raft, to try to make sure we can work more effectively. So again, I think I could give, the next year's report will make better reading in terms of what progress has been made in terms of some of these areas. And like I say, don't let me wrong, nobody is saying the job's done, nobody is saying we're not still on a journey, nobody is saying we can improve. I mean, even the Families Commission's work, there is now a clear plan with the partners that we're looking at. I'm looking forward, for example, tomorrow there's the Safe Lives workshop on domestic abuse, which I'm seeing as part of the partnership's response to the Families Commission asking about how good is the support for those exposed to domestic abuse in the county. So again, that will then emerge as a response from the partnership to the Families Commission when that piece of work is done.
Okay, well, I mean, I look forward to next year's report and to have it sooner in the year. But you know, I hear what you're saying. But you know, we just heard in the previous agenda item that, you know, we've got some real challenges put to us from the Children's Commissioner in areas which include partnership working. So, you know, where there is resistance to acquiring a common approach to referrals or to assessing, you know, cases in terms of risk, you know, we need to overcome those hurdles, because if we're not taking a common and a commonly agreed approach, then we're still going to get the lumpiness and the differences and the attrition in terms of the referrals that we're getting from some of our partners, which is creating a huge burden of assessment work that is nugatory in other parts of the partnership. And we have to get on top of that. And that's just one example. So, you know, I hear everything you're saying. I don't underestimate the scale of the problem, but communication and coordination and, you know, sharing of what we're doing is surely at the very heart of having a partnership. And it's not the thing that slides away because we're too busy being busy.
So I appreciate Council. I mean, as an independent scrutineer, I look for evidence. I have to have a balance. There are challenges. But I have to say, in terms of, let's sort of straight some of the issues, and again, I'll probably look at Helen still here from the police, yeah. So let's take the front door, where the statistics suggest contacts, particularly from the police, are high, the attrition rate's high, and so on. As Darryl has already, the Chief Officer's already said, and indeed again on Monday's Q&E, I've got the new dashboard, there is progress in the right direction in the MASH, in the way contacts are being held. But I think one of the complexities of getting a certain area like, which is police contacts, is West Mercia Police serves 5 partnerships. What it does for Herefordshire, obviously there's a pressure from the other partners to do the same, as we would vice versa. So what's taking time there is, my understanding is Leanne Lowe, who's the West Mercia wide police child protection lead, is trying to improve our arrangements in a way that can be sustained by the force across the 5 areas. There's no resistance in terms of discussion about the numbers. There's great discussion. Local moderation has been tried, but actually the long-term solution to that is complex because of the fact there's 5 partnerships that the police serve. And in the meantime, I mean, every audit I've seen on the MASH says that volume may be wrong, but the right decisions are made. The audits all say it's safe. Ofsted say it's safe. And there has been this switch into early help, which the numbers do confirm. But I think I've got that right, Helen, the police perspective, have I?
Yeah, absolutely. In terms of sort of the complexities of West Mercia Police operating over multiple local authority areas, that's absolutely right. And I don't want to go into the detail of the work that Leanne's doing, because it's her that's leading on it and I'm not cited on the finer detail, but there is a lot of work going on looking at how we can better triage at the very earliest stage the contacts that are coming in to make sure that we can have an impact on that attrition rate from the police contacts.
Well, it's not the first place to go. The area that you serve that has the lowest attrition rate on your referrals, and see what your referral process is there.
So I think that'd be Telford and Wrekin, from what I know of the partnerships on the piece. And they have a different structure that the police have in that area. Am I right? I'm looking at the cabinet member who knows of these things. So there is an example. And Leanne has also done extensive work with the Humberside model, which is a nationally known model that has got this problem solved for that area. But then, you can do the maths of the consultation that has to be held. If you're just working... So when I was down the road in Gloucestershire, 1 police force, 1 council, 1 ICB, things could be done very quickly. When you've got an area where you've got an agency that covers 5 other areas, it's much more complex to get decisions made and resources allocated. Yeah. You want to come in again? No? Yes? On that?
No, I wasn't going to come in again, other than to absolutely agree with what you've just said, Kevin. Telford, you're correct, it is Telford that has a better conversion rate. However, like Kevin's already alluded to, that they have a very, very different setup, both in terms of their technology and their working arrangements. So it's not a simple lift and shift to bring that in here, because that would have an impact across all of the partners, not just policing.
And that's frustrating. It is frustrating. And if I'm sat on your side of the table, I would be frustrated. But I'm sorry, it's just me. I'm trying to get an honest and balanced picture of a partnership that's on a journey, because sometimes I observe, and I've seen several of these improvement journeys, it's unless you do that, you spend 99% of the journey feeling everyone thinks you're not doing anything, and then suddenly one day everyone agrees. So I'm trying to get a balanced debate of what's happening. So I can assure you, I've had constant conversation with police colleagues. I know Darryl has, since last November, about what are we going to do about, what are you doing about those contacts, what are you doing about those numbers, and that vigilance is there. So I think there's a sign that there'll be a step change in those arrangements within the next, I should imagine, 3 to 6 months, because my understanding is that Leanne Lowe has been round the other areas and talked to everybody, and he's trying to get the consensus around what the West Mercia approach will be going forward. And we look forward to that. But in the meantime, as Darryl has alluded to, checking the dashboard literally today, some of the numbers are converging, and some of them are looking more like statistical neighbours. So small steps on an improvement journey are well worth recognising. And that I know that now because of the vigilance that's given to that information. And I'm not sure that that was as intense, 14 months ago. So that's a step. The Section 11 challenge exercise, literally we completed just before Christmas, has given a really good insight into the strengths of the agencies as individual agencies. And I like the phrase Councillor used earlier because I use it. Individually, most of the partners here are quite strong in terms of safeguarding. But the whole is not greater than the sum of the parts. And that's the challenge of partnership working. How, if you've got, it's belt and braces, you've got to have both. And I think that's the journey we're on, is making the whole greater than the sum of the parts.
Yeah, it's where things multiply rather than add. Sometimes you multiply risk, or you multiply risk aversion, and you get a very different answer than if you just added those numbers together. So yeah, I understand that. And thank you for your very honest and candid assessment of what's going on. I don't underestimate the task, but my face does example the frustration. Yeah, so apologies.
I think some of the issues that you raised also come down to the issue of data and the sharing of data, and it would be quite useful to know what progress has been made on developing a multi-agency data set that informs the partnership work. And then also, I assume that looking at how sort of different partners ensure that the right support at the right time is received, and based on, I assume, data that different partners have.
I'm getting conscious it's getting to be a sort of solo act from me, which I'm trying to avoid. And we've still got a challenge getting multi-agency data complete. We have ongoing conversation, particularly with West Mercia Police, about getting hold of data. And I do have a conundrum about data here, because when I sat in the Community Safety Partnership less than about a week or so ago, I saw lots of data, including police data. And I'm still challenging here as to why, if you've got all these numbers, can't we not bring them together in a coherent whole? That's what I see. So there is more data. So we've got a particular issue there. Has progress been made? We now have Wye Valley Trust data going to the partnership. We have an embryonic Power BI safeguarding partners dashboard being supported by local authority. It's still work in progress, but that wasn't there 12 months ago. When I look again at the QE agenda, which I think is Monday, it now receives a dashboard from Children's Social Care, and within that there is the data about the contacts, there is the data about the referrals, there is sufficient partnership information, I think, for the Q&E group now to do the next challenge, which is look at that data, what's it telling you, what you do about it. Would that be fair as Chair of Q&E?
Yes, I think it would. We've certainly been on a journey in terms of understanding our data and establishing a baseline in relation to that. The data from Wye Valley Trust is more comprehensive in terms of understanding mandatory training in relation to safeguarding, but also levels of supervision, routine inquiry in terms of sensitively making enquiries when talking with individuals and parents around potential domestic abuse and indicators. We're also starting to get some data in relation to children and young people who've been admitted to Tier 4 provision, so CAMS provision. As part of that, and we're able to cross-reference our data now in terms of health attendance at strategy discussions, child protection conferences. So it's given us the opportunity to overlay some of that data and look at it as a collective rather than single agencies, and starting the conversations and the professional curiosity around what the data is telling us, and understanding the story behind the baseline, because behind every piece of data, of course, we're talking about children, young people, parents, families, and how we engage with them in terms of safeguarding and promoting their welfare.
So can I ask a question about that specifically? Do we have the right skills in the council, in the partnership, to be able to analyse that data properly? Because it's something that comes up time and time again. Do we have a children's data analyst?
Who wants to say no in a polite way? I don't think we do. I think the partnership has tried to put in place such a post about a year ago. We had 9,000 tried to get some work done, but we couldn't recruit anybody. That's my memory, and we're moving on from there now. Yeah.
So the Safeguarding Partnership doesn't have a children's analyst. The council has a performance and intelligence team, and there is a children's analyst and other posts within there. I think as our data gathering and our use of data changes, that's a resource that is constantly being looked at the minute. And I think, I'm on record internally certainly of saying we need a different and a greater resource going forward, because we become so much more heavily reliant on data. But certainly each of the statutory partners around the partnership, all of us have our data teams and the like. So the bit that we haven't quite cracked yet is how we manage to ring fence and protect or allocate a resource from within the partnership that supports the work of the partnership itself.
Have we done anything across the partnership to identify how much of people's time is taken up doing bits of this that would make it much more efficient for us to have somebody, people dedicated to it, rather than all the headless chickening that seems to have to go on?
So, in a previous, I've said, let's get all the data people in a room, and you go, you show me what you've got, and you go around. We haven't done that yet. I mean, I must admit, it's taken me a while to get the map, but Police and Crime Commissioner is about 5 analysts or something. He's got a resource, and as Darryl says, each individual agency. And I think we recognise we probably need to make that step. In authorities I used to work in, we used to have things called observatories, and the observatories did precisely that. They got all the intelligence people from all the agencies into a single place. Having said that, you've got Understanding Herefordshire. This is my conundrum. When I find the right place to look, I begin to see the data that I want to see. So I'm halfway through a sort of sketch report that goes, I went to this and I saw this data, and I went to this, I saw this data. Because that's where the Scrutiny can be helpful to the partnership. I just tell them the way I see it. I suspect there is a piece of work needs to be done to bring this all together, and that might well need, as Darryl said, some sort of resource, either potentially temporary to bring. Once you've got the thing working, it can be maintained a lot easier. It's getting the time to do that innovation. But yeah, that's. I did have a chat with Paul Walker about that, and I think he went away thinking about that. And my understanding is the Directorate of Public Health is now looking at performance information across the whole council and the systems, and indeed he obviously is engaged in the partnerships. So it's certainly on my list every time I see Paul for my one-to-one. What are we doing about this? So,
Heather Manning, did you want to come in now?
Yeah, if that's okay. So just to highlight as well, the information, for example, in health, so from Y Valley that goes into the quality and effectiveness group, that is already formed part of our assurance from them as our provider, and is discussed in a safeguarding committee meeting that Y Valley host, that one of my team attends. So we have that assurance, we're able to politely challenge back if numbers are not quite where we would expect them to be, lower supervision levels, for example, if, we highlight. And we see their data quarter on quarter on quarter, so we have a direct correlation with previous quarters and can see trajectories, etc. That information as well within their assurance also goes then to their trust board meeting. So it's analysed in that area as well, which again, a senior person from the ICB attends. So the analysis, if you like, of the Y Valley safeguarding information does go into a number of different committees and board meetings before it reaches Q&E as well. So just for some assurance.
Okay.
I think, Chair, I mean, Heather illustrates a point I have to make about the independent scrutineer's role should be very simple. It should be ask each of the major partners, how do you know you're effective at safeguarding? And when we've asked that question in the Section 11 challenge, we've got quite strong replies from individual agencies. And Heather illustrates that, and the police have a system, and the Wye Valley Trust have a system of safeguarding committees. But that isn't evident in us as a partnership, and that's the step we need to take, either by using that information that already exists in a different way, or by developing partnership information the way we've discussed about getting data in a dashboard. But yeah, so still more work. That would be one area I'd say, yeah, next year ask us how well we've done in developing that area. I have a particular issue around our profile for child exploitation as the independent scrutineer. So I'm asking that the profile be redone because it was last done in 2019. And then at the CSP, as I say, these things keep appearing. I then saw some very useful information I hadn't seen before pertaining to child exploitation statistics, which I'm now following up. So there are challenges to the partnership that certainly I and others are making that the partners are aware of.
Thank you for that. Councillor Proctor, yes.
I do have a question, but I'm going to make a small observation just because my day job, I work in data analysis, and I would definitely get your data people in the room. That is a very simple thing that would deliver you a lot of outcomes. But my question is comes from the same place. So the sorts of data that you have described is exactly the sorts of data I would expect you to be looking at. The temptation is to only look at this sort of data, and that means that you miss qualitative data, impact data, the voice of children. And so how are you going to ensure as a partnership that you don't just focus on these kind of processy things, but you actually have the voice of children, which I admit must be very hard at this kind of rarefied strategic level, but it's not my job to solve that problem, but to ask the question.
So to evaluate the effectiveness of the partnership, you need a variety of data. So you need qualitative data. That's why, certainly since I arrived last November, pressed hard to see the multi-agency auditing. And indeed, through the Section 11 process, I also found that the individual agencies do a lot of auditing that I didn't know about, so I'm going to get hold of that. So that's there. Then, you were saying earlier about complaints, and occasionally cases are shared with me that I use to evaluate effectiveness of practice. So yeah, you need a variety of data, and that's what I've personally been talking to the partnership about, and that's what I think is now much more in place. And then you correlate that data across piece. Another bit that I must say is working well, because when I first came across it, I wasn't sure, which is the joint case review group. And you'll notice in the annual report, it also includes adults and the domestic homicide reviews, which again, a great source of data on practice. And the reason that is because it looks all three. It does the children's reviews, it does the adults' reviews, and it does the DHRs. It's chaired by Heather. And when I first came across it, I thought, I'm absolutely converted to it. It's not my idea. It works really well. So the other source of data is the rapid reviews. November 22, when I started, I observed that I didn't see the amount of rapid reviews that a partnership of the size of Herefordshire should normally do. We now look normal. And those reviews and the process of determining whether a review is well managed and effective. So you're absolutely right. Got to build the data, and you know, and get it all in order. Because the other thing about the numbers is you might get good numbers, but are they on the same time scale? You'll know all that. So qualitative data and quantitative data have to be, and then walking the floor, and that's what partners are endeavouring to do now, is get back to walking the floor, so they themselves have line of sight. And that comes to capacity, prioritising diaries and so on. So variety of data used.
Thank you. If I can go to the point about the pace of change, so the slow pace of change has been commented on by both Ofsted and the Commissioner. You know, there is the question, how can partners help increase the pace of change? One of the interesting things I read was an LGA example on Reading, when Reading was inadequate. And one of the things that they did to increase the pace of change was live auditing. So actually, as cases were sort of open, they had a group of people actually looking at that and improving the work on that as they move through, rather than in hindsight. I don't know if this is something that Herefordshire is involved, become involved in, but it is that the question is, how are we going to increase the pace of change? How are partners taking that on board? And once something's established, it becomes easier to achieve.
Yeah, so thank you for the question. So next week we are going to have a multi-agency review of the MASH with Leeds. So that will be Leeds, Children's Social Care, Education, Health and Police. And as part of that work, we are adopting a peer review methodology where colleagues will physically go into the MASH, will talk with MASH practitioners in relation to their day-to-day activities, will observe some of the practices in terms of talking to referrers. And so there will be the element of live observation and be able to engage with those practitioners, as well as following through some of the journeys of some of those contacts or referrals.
I think I'd also add from my observation, again, you know, I made that point about people being very busy and sometimes too busy to know report. So the MASH for a long time has had regular multi-agency audits amongst the team. And what I've tried to correct is, where's that reported to? How do we get sight of it? And that would be another example where practice is probably marginally better than observed by people who don't know those audits are taking place because there is no report somewhere. So one of the governance changes, for example, was to this past 12 months or 10 months, the MASH group reports to the QE group. So the QE group gets oversight of the data. So it's another partnership level of reviewing what we're doing. And I'm looking forward to the outcomes of this next review as the independent scrutineer, because that'll be another line of sight exercise for me when it's done. So.
Thank you. I just wonder if any of the kind of police or health partners have a view on that sort of pace of change. If, you know, is that something that is sort of continually being considered?
Yeah, from a policing perspective, absolutely. So the staff within the MASH aren't mine. They belong to Detective Superintendent Lowe, who heads our Strategic Vulnerability Department, but she's been doing some work around collation of information on a case-by-case basis around strategy discussions and child protection conferences where the staff are recording that data. It's very early stages. I think she only started it in November. But the aim of that is to do exactly what you're referring to in terms of picking up issues at an early stage and learning from them with colleagues in the MASH, rather than, you know, waiting for issues to arise later down the line. So that's absolutely something that we're cited on in terms of the need for additional scrutiny, audit, and the pace at which that needs to be done.
And same really from a health perspective. You know, we're a really small team in the ICB, but we're committed to supporting with that, and we do support with that. It's the same with our providers as well. You know, they do their own audits. That gets fed back into sort of Q&E subgroup as well. So those audits are completed internally, but with groups of partners as well. So, for example, referrals, you know, quality of referrals, etc., and what that looks like. But equally, they also do the multi-agency audits. So we have a health practitioner that sits in MASH, that is part of the MASH that we commission from the ICB, and Y Valley provide that. So they're involved with the internal MASH audits. And then we also have Y Valley providers who sit in Q&E subgroups, etc., JCR. So we constantly have those people sitting in through the levels that are committed to being part of those audits and that pace of change as well.
Thank you. Just in terms of referrals at the MASH, so the data that we've seen sort of so far sort of suggests that referrals are decreasing. But and again, it comes back to this question about the I'm just the right, you know, the right help at the right time, and sorry, I'm just trying to find it. So the right time, right help document, it's not very easy to find on the partnership website. When I did find it with a Google search, and actually it was what came up was the 2021 framework, and I just wondered whether this has been updated since working together 2023. Is there an update to the right time, right help, and how is the work happening within the partners to make sure that referrals are the right referrals are being made? Because, for example, again, it comes back to the police example, because there are lots of referrals from the police, and is that a case of obviously if an issue comes up, the police become aware of an issue and they need to raise it somewhere, is it going to the right place, or would the first point of call be the chat line, for example, and then whoever was raising that referral might be directed towards some early help intervention? How does it work? Is the framework being used in the right way?
So I think that comes back to what Kevin mentioned earlier in terms of the visit to the Humberside and the review around how we initially triage those contacts. So from a police perspective, if a frontline officer goes to any type of incident where they have any concern around a child, they must create a risk assessment, which then generates what we would call a referral. I know terminology in terms of contacts and referrals is a little bit different. And we're scrutinised heavily by the HMIC, etc., in respect to that. So I cannot tell my frontline staff, do not put a risk assessment in if you have a concern for a child, because they are statutorily obliged to do so. So it's what we do as a consequence of that. And I think that it's that middle step between the officer putting the risk assessment on and whatever happens in the MASH to look at, is there an alternative diversion here for lower level incidents? And that is exactly the piece of work that Leanne Lowe is leading on.
Yes, Director.
The right help, right time threshold document that's on the partnership website is November 2020, and in fact the partnership updated or signed off an update to it last week at the meeting. So you expect to see it. We tend to review it every year, but don't necessarily make changes every year. So it's been reviewed, and some minor changes have been made, and they'll get published shortly. The document, the threshold document for any local authority, they don't change much, frankly, from most local authorities. It's a pretty accepted set of thresholds because most of the services that they describe are statutory services. Certainly Ofsted and others have commented on ours and said that it's a good document and clear. We know from some of the work we do with frontline practitioners and practitioner forums that it is used and it is widely used, but it's not intended to be the go-to, and it's got all the answers. It's expected to be a guide to inform professional conversations. If you're a professional working in any agency, then you have that document. You do have the chat helpline that you mentioned. You also have, in most of our agencies, the option to have a conversation with either a safeguarding lead in your service or your professional supervisor. So there's a range of different ways that you expect professionals to be able to go and take a concern or a thought about what's going on with a family to go and test that out before you make the referral. But families and professionals can ring either the chat line or the MASH and just describe the need or the concern that they've got, and then somebody will pick it up from there. So it's not meant to be the absolute document to which all answers are contained. They rarely exist. It's meant to be a practice guide and a practice framework, and it really doesn't differ much to that you'll find in any other local authority other than by presentation style, because the services are largely prescribed by legislation.
So I think that sort of what you're saying is, again, it comes back to if we're trying to stop children entering the social care system, then and one of the ways that they do is through these referrals. Actually, what you're saying is that comes back to the point about locality arrangements, and if there was support that could be offered, when concerns were raised, for example through a police risk assessment, that could potentially be sort of dealt with in a locality arrangement, that and the support offered to the family, that is a different route that could be taken instead of potentially going down a social care route. Am I understanding this right?
So just to be clear, so we're not trying to stop children coming into social care, because actually for some children that's absolutely the right thing to do. What we're trying to do is strengthen our early help and prevention arrangements and a wide range of services, so that for some families we're able to avoid that by intervening sooner and earlier as a need emerges. But there will always be some children and families who have a level of need or where risk is demonstrated such that a statutory intervention will be required. So it might sound like semantics, but I think there's a danger sometimes we get stuck on or hung up on the numbers rather than a range of services that are provided by the partnership, so that families and communities who want a little help can easily access information to know where they can get a little help. But where there are higher levels of need or higher levels of risk, we also need to make sure that families or professionals who want to make a referral can do so in a simple, easy way, so that we're able to respond in a timely way to reduce risk. I absolutely believe that working in a more place-based locality way of working will make a huge difference to strengthen that spectrum of services that are available in any given area, particularly as it will improve the relationships between professionals, between different agencies, there's a lot of evidence around integrated working over many years now in many parts of the country, which show that really does make a difference in terms of how you deliver timely and effective services. Some of the work that we'll be hopefully trialling a little bit later this year with our colleagues from West Mercia Police is what's going to be called Pit Stop. But essentially it's where we bring colleagues from a range of agencies together, building on some work that's been done on Humberside. So we're also trying to learn from what has worked well in other parts of the country to make sure we strengthen our local services.
Thank you. Just one point, Director. You said we don't want to get stuck on the numbers, but I think the numbers are an issue, because what we're being told is that the numbers are too high, because according to our statistical neighbours, they are too high. So the numbers are really important.
They're a proxy, they're an indicator that either something might be going well or something might not be going well. But equally, what we don't want to do is get to a point when we say that number is okay. What we need to make sure is that we've got the right services for children and families based on the information that we've got. So yeah, I wasn't suggesting that you ignore the numbers. We've known, and we're working very hard on making sure that our numbers as an indicator of what's going on are much more healthy as a proxy and an indicator. But actually, the worst thing that can happen going the other way is you say, well, if 400 is wrong, 300 is right, and then all of a sudden we become happy that there are 300 of a certain type of child in a category. And numbers are an indicator that might be that something's going really well, or something's not going so well, or at least that there's movement. But part of the work that Scrutiny have done very effectively in the past, and that the Safeguarding Partnership do, is to seek assurance that the right children, those that need protection, are being protected, and that we've got the right services being developed or in place across Herefordshire. So that's what I meant by not getting just fixated on the numbers, because neither one nor the other is necessarily right. It's what do those numbers tell us about the services that families receive and how we're managing risk.
Thank you. Does anyone have...
Chair, if I just add something to that, the beauty of the working together since 2018, and something I Scrutiny constantly press, and others, it is a shared and equal duty now. So the solution to, if it's risk aversion, whatever is happening in groups that make decisions, I'm constantly saying to partners, that's not just children's social care, that is a partnership decision. And that's coming back to its earlier, that's what the importance of getting that restorative methodology shared, operated, understood. And the other thing that improving systems need is to build the confidence among staff that they can make the right decision, because when everything, all that's going on, all the risks, you can understand the dynamics which might make some colleagues on the front line more risk averse than if they're confident, they feel supported and so on. That's part of the improvement journey. It takes quite a long time to achieve that.
Thank you. And I think that that's one of the issues about having a high majority of agency staff as well, is that it is a more risk-averse workforce rather than a partnership of people who actually know their locality well, they know their families well, they know themselves well. So I think it's an important point. One of the questions I wanted to ask about was the trauma-informed approach, and what you mentioned that it is sort of again part of the kind of I think you said part of the restorative practice. But how have the partners actually sort of taken on the trauma-informed approach, and what difference is it making to sort of perceptions of people, families, and children in a sort of working scenario?
Okay, so Steve, do you want to? Can I, Steve Heckle, people, the new interim business manager, councillor. So.
Yes, thank you. I'm aware of the trauma-informed approach. Obviously, just bringing up to date the families feedback action plan. So I am aware there has been a trauma-informed approach training rolled out to staff by the partnership, and that's taking place through 23-24. So that knowledge is now there, and the practice is available to the staff. So there has been action completed via that as a result of that families feedback report, and that is in place. Measuring impact, again back to Kevin's I think first point in the meeting, that it is very challenging to measure impact through as to direct impact on children and families. One of those impacts certainly would be seeing a reduction in referrals, inappropriate referrals to the MASH within Herefordshire, yes. Another would be obviously to seek feedback from families who have been worked with on this approach, something for the future. It is relatively new, the rollout of the training, however, so clearly we need to give time for that to be embedded before we could see outcomes from the children and families and seek their views on it.
I think the training has been attended by all partners, that, you know, it's across the spectrum, but Steve, that's the next step. We've done that input. What difference has it made to practice? And that will take a little bit more time to assess. I'd hope to see differences in case audits. Identification of good practice is also something the partnership needs to get better at, in terms of them being able to show that the inputs you've made around training, whether that's neglect, the graded care profile, trauma-informed, is making a difference to practice. And that's something the partners need to think about. How do you get line of sight on what's changed at the front line? And I think, you know, I've been chairing the partnership this year. Next year, when I set up my plan for the Chief Exec on scrutiny, one of the empty columns I've got at the moment is how do I, as a scrutineer, go out and find what difference these things are making to people, and I may well hold some sessions with families or something like that to try to get some direct feedback, having been so impressed and moved by the Families Commission and hearing directly from families about their experiences.
Thank you. Councillor Proctor, you had a question?
Yeah, so we talked several times, I've heard that measuring impact is important, but it's very hard to do. But there are models that help with that, like theories of change, logic models. So is that something that the partnership is using? Because that means you can measure the things that you can measure, but you have a clear model of how you expect that impact to be felt.
Go on, Steve.
Okay. Yes, with so much change in so many strands, and there is, and as I say, I think it's my third or fourth week here, I can see how much work is being done. It's very, very difficult. The reality is to say, right, we have made that change, pulled that lever, and it's resulted exactly in that improvement or that change to children and their families. It's across the board. There are a number of improvements, and we are looking for what collectively those changes have had for the better on children, young people and their families. So looking at that, we've already talked about numbers, quantitative data and changes in referral rates to Family Front Door and, sorry, I apologise, MASH, and to early help services and responsibilities in Section 175 audit for schools, the use of early helps there, measuring that, the Section 11. But with the audit processes that are now in place in Herefordshire, and I've already seen them, Kevin has already alluded to the child sexual abuse case audit that's been completed and is coming to our quality and effectiveness group next week. And I know, because I was speaking last week, that last week multi-agency practitioners met to do a child-on-child abuse audit, case file audit. There will be learning from that, and we will need to ensure that that audit, that learning is embedded. It will then need to be revisited, and further case audit. Are we still identifying the very things that we saw and identified in the initial audit, or are we seeing an improvement? And those are the sort of ways that we'll be able to measure change. So it is both qualitative and quantitative.
I think it might just be language. I think I still kind of hear a gap between there are lots of things that we are doing which we think will drive improvement, and then there's ways in which we might measure impact down the line, but it will be very hard to attribute that to specific things the partnership's done. And the gap would be an explanation of how you think these changes will deliver impacts. And I guess I'm just asking, what is the clarity about when you're making these things that you think will drive improvement, the way in which you think those improvements will be felt?
I'll give you one example. It is complex in the field of social care. It doesn't mean we shouldn't be able to do it. So take the neglect strategy. The graded care profile is a tool that you ask agencies to use, which helps identify neglect. And to try to measure the impact of that, we did a case audit in the last 12 months, looking at how the tool had been used, and what that told us was where it was used from case file examination. It appeared to improve the way services were being organised to help that family. But what it also found was it wasn't being used often enough. There wasn't a marker being picked up from case file audit that the tool was being used. So the partners explored through the learning development group what the reasons were for that, gone through a sort of mini launch, for want of a better expression, about the profile, and then that exercise needs to be repeated again. So that's one example of something the partnership can follow through. At the end of the day, I get my best insights into the quality of safeguarding provision through case audit. I have to say, if you have to say to me, you've got one tool, because it's when you read, even just reading files, you can get a feel from language, from tone, from the way the meetings have had. Now, of course, ideally, you then back that up by actually meeting some of the families involved. Now, you can't do that with all the children you're dealing with, but you can do enough to do assurance. I'm not speak on behalf of Darryl, but, you know, restorative practice, team supervision, this sort of how are we impacting children should be part of the daily conversations that happen. And I know Darryl's saying yes, and that's the same. I mean, we found in the Section 11 supervision is quite strong across the partnership in terms of safeguarding, in terms of one-to-one. So yeah, I think there's a sense in which, I think Steve's alluded to get to the point where you can begin to ask those, what I call the sophisticated questions about how do you measure impact. You have to have certain architecture in place, like data, like training, etc. And I think in the last 12 months, this partnership has got some of that architecture much better in place, but not enough of it yet. And once that's embedded in, some of the things we've done embedded, you'll then go to the next level where indeed you'd ask more searching questions about, well, what difference did you expect to make? Are you seeing it? Now, I could scribble down things like that now, but that's probably the next bit of the journey if you think of an improvement journey in stages.
Councillor Harvey.
Thank you, Chair. Not completely about this report, but about the partnership and partnership working. We've just been going through in the last couple of weeks scrutiny of the council's draft budget in the run-up to setting the budget in early February. And I'm just wondering, did partners play a role in getting the balance of the budget right for our children's Directorate? Did you get to comment on that, and where, you know, do you think that sufficient provision is being made in the right areas to address what, you know, is our core business? I must say, I'm also
So
on a on a working group for looking at the police
Right.
the police and crime commissioners.
Sure.
But budget, so you know, same sorts of questions.
Right. So
apply
what I've
the other
observed
way.
in terms of partnership working, there's been a
Yeah.
detailed discussion on the budget for the partnership going forward, and that's looking to be resolved. I observed some really interesting discussions within the Community Safety Partnership, chaired by Helen, about what would be the priorities for the resources been available. But in terms of the wider council budget, I defer to Darren and the cabinet member indeed on that.
Councillor Highfield, yes.
The next agenda item. We've got a report on that and questions on that, surely.
Can we keep that to the next agenda item,
Well,
Councillor
it
Harvey?
isn't covered in the next agenda item. I'm really just asking about, you know, the wider partnership working. If we're looking at joint commissioning and things like that, that's all about how we pool our resources in order to deliver across the partnership.
Okay, thank you.
So the safeguarding partnership's primary responsibility is to make sure services are in place, and typically it doesn't ask the individual organisations how its funding is put in place. Obviously the board or a partnership generally gets involved if there is an absence of a service where there's been identified a need. So we don't have detailed conversations in the partnership around individual organisations' budgets. Where the budget gets discussed at the partnership, as it did last week, is the partnership's contribution to the working and the operation of the partnership itself, and how we support the work of the partnership. Where we talk about resources more typically, and in conversations that Superintendent Wayne and I have had and others, is in terms of the people that go into, for example, the MASH, or the resources that go into the MASH. But it's well outside the scope of the safeguarding partnership to discuss or comment on individual services budgets, unless, and this hasn't happened, unless those organisations were then not able to contribute to the safeguarding arrangements of the partnership itself.
I think possibly also it's a discussion around the kind of collaboration between different partners and in how services are delivered. But I'm conscious of time, and one of the questions I did want to ask was how the partnership intends to work closer with schools and other educational establishments. And I'm wondering whether the engagement with schools could be incorporated into work on engagement with children, young people and families. Is this something that could be done through the partners? How could it be joined up? And could this work help inform provision of youth services using grant and funding that's available, for example? How's it going to be done? How could it be done? What would be the best option?
So we've already opened dialogue with the Director of Education here in terms of how education in a broad sense, how we move closer together as a partnership. That started a while back, and very positive to report that there's good links between the education department and schools. There's a designated safeguarding leads forum, there's a safeguarding officer within that structure. My observation was to date it's been disconnected from the HSCP. And under Working Together 23, we must address that gap. So that is now going to be out for discussion, because I think we'll have to go out and discuss with schools whether they want to, if they want to be on the board, who would be on the board, whether there's other relationships. So it has been raised now under Working Together 23, and Working Together 23 is much clearer that schools are expected to engage with the partnership arrangements. And the word is that if we can't get it done voluntarily, this government's considering looking at legislation. As long as I can remember, I think Steve was there the same, working in this business, the role of schools within the safeguarding arrangements has not been clear enough for some of us, should I say. But it's all about the autonomy of schools, excuse me. So that we have to address it, but there are some strengths to build on.
The challenge, and it's one that we need to work through, is it's not just about schools, it's about the education sector, strengthening the engagement with the education sector, and actually schools under local authority control particularly, are probably the most straightforward to engage with. We need to think about our independent schools, we need to think about our early years settings, early years providers, private early years providers, specialist education, further education. We need to do that in a way which isn't just, and there is a risk of doing this, tokenism. Yes, we'll have somebody from a primary school somewhere in Herefordshire. Well, they clearly can't speak for all primary schools in Herefordshire. It's a piece of work that we've already discussed, as Kevin's alluded to, in the partnership board about how we're going to do this. There are different models in which we can do it, and we'll need to consider each. But definitely an area of strengthening, not impossible, but not as straightforward as Working Together would perhaps outline, as engage in a more positive way with education settings. It does need careful consideration. It will be done during this year.
Thank you. Yes.
Thank you, Chair. Just on that point, because the way that you were discussing the schools, and I totally get the independent nature, autonomous nature of schools. Just as an example, one of the priorities that's in the report is linked to Section 175 audits, which are obviously part of the Working Together policy. One of the questions that I was asking at the school, I'm parent governor, because you can't see that, co-opted parent governor, working with our DSL on submitting the audit. And one of the questions I asked was, what happens? What happens next once it's been submitted? So as an example of the level of support that's offered, is there a next step? Was that an area that, and we're talking about obviously safeguarding audits and the materials that are provided and the support that's offered in a two-way process. Was that an issue that you identified as something being overlooked or not dealt with because it's in the priorities going forward section? Is it something that was just triggered? It wouldn't just have been triggered actually, no, from Working Together, would it? Because it was flagged earlier. Essentially, what happens with that information is basically what I'm asking. And the reason I'm asking is, what's the two-way process with that? So I know what my school entered, because I was there to actually complete the form with the DSL. I know there are still areas for development. And I know that some of that responsibility is connected to the partnership that we've been talking about this afternoon. But it's been done, tick, or is there other information that's provided?
So when I met with Liz, the director, and I asked, this is what I'm saying about the connectivity. So I asked the question, do you do a Section 175 audit? She immediately pulled up the slides for the presentation she gave to secondary heads, primary heads, forum meetings she had, which was the aggregated results of the 175 returns, which identify what they thought were the strengths identified and what were the challenges. And then my understanding is then they work within the current arrangements, which can be anything from encouraging schools to do something for themselves through to whatever support is available to do that. And so I said, has that been presented to the safeguarding board? And of course it hadn't. So we had her come to, not the last meeting before last, and that's where we've begun to open the dialogue about how do we connect this good piece of work that goes in schools back into the partnership. and that's what we are doing. The audit's now gone out again, I think, from memory, or is about to, and we're going to wait for the results of the next. Now, what ought to happen is there ought to be debate at the partnership board, and the board ought to pick up anything. Let's say, I don't know, schools identified an area of, we're concerned about what happens outside the school gates. That might be for the partners to say to the police, well, you know, can we have a discussion about local policing or PS, you know, so that's how it should be used. So it's reconnecting something that, as I say, I was very pleased when I went to see the director that it was there, but I didn't know that from reading the papers of the partnership board. Simple as that.
I think that was one of the issues as well, that there were mention of working with partners. That's, you know, one of the, well, not one, it's some of the questions that are involved in the 175. And it is that connection that's not necessarily, and this isn't necessarily my experience in the sense it's not happening to me, but from the school's perspective, and I suspect that's replicated across a whole host of schools, that they're doing this work. And I know that the Director of Education and Skills interacts on a whole host of areas with different schools across the county, because again, I've witnessed that in practice, but it's that connectivity of, okay, so I've done the report, I've produced this, what happens now? And again, it comes back to the trust element that we started off really early at the beginning. It's from a school's perspective, what else are you expecting us to do? What else, you know, you talked much earlier about the hubs, having hubs within schools, but it's about that trust element of how are we working together, literally, because of the actual text itself. But that's a good example that it is happening, but you're connecting those pieces together. Thank you.
And I think it's clear that there's much more work that needs to be done on this, but so potentially this is another conversation we can bring back to committee. Unless anybody's got anything else they want to say under this agenda item, if I can bring that to a close, are there any suggestions or observations that anybody would like to bring forward around that discussion? I think one of the things we've said, the neglect strategy will come, and you know, thank you for the report on the progress. It's great to see that the partnership is making progress. It will be very good to have that update on the 23-24 situation, and hopefully moving forward. So if there's anything that anybody's picked up, can you, Ben, Councillor Proctor?
Two things. One very specific, which is I would like to recommend that the partnership has a workshop with all data analysts from across the partnership. And also, I think I'd like to recommend that the partnership focuses this year on that. What are you expecting to see if this improvement happens? Question.
So you're referring to the impact?
Yeah, this is slightly short of impact, but it's the kind of next stage from we've done something, but when we made this improvement, what did we expect to see, and are we seeing it?
Okay. Are those recommendations?
I think we can work something on that territory, because again, as the scrutineer, I'm going to have to ask those questions myself. So I will find a way of reporting back to you.
So is everybody in agreement that we could make those recommendations as the scrutiny committee, the voting members? Yep. Yes. Great, thank you. Have we captured that?
Yes, we have.
Thank you very much. I'm very conscious, and thank you for the report. Just conscious that we haven't had a comfort break, but we've got we've got 25 minutes before 5 o'clock. Is everybody happy to carry on with the final agenda item, or is anybody desperate for a comfort break? Nobody seems desperate. So if we could carry on. Thank you very much. It's been good to hear back. Right, so agenda item 9 is the task and finish group, children and young people, looking at to provide the Children and Young People Scrutiny Committee with the findings and recommendations of the Scrutiny Management Board's task and finish group, scrutinising the current expenditure, future budget of the Children and Young People Directorate. So the report has been published in a supplement to the agenda. And Councillor Harvey, first of all, I would like to thank you and all the other members who contributed towards this task and finish, and for all the officers that contributed as well. Would you like to talk us briefly through the report that was published yesterday?
Yes, and I'd like to start off by apologising to committee members for the late publication of this document. It has been produced to the same sort of tight timescales and pressures that the budget more broadly has been subject to, and it's also been involving the same officers who have been very closely needing to be involved in the wider council's budget, from both the finance team and also from Daryl's team, and as a consequence they've been spread very thinly, so that's partly impacted on the timescales we've been working to. The committees met in person once, and I think we met twice in terms of online, looking at a number of documents that were provided to us. Some of them in confidence. They were documents that were provided for information to Cabinet. But what they did do was provide us with information about how the oversight of delivery of services in this directorate is being undertaken on a monthly basis, and more frequently than that, in terms of keeping an eye on the cost consequences of decisions that are made about care packages weekly in some instances. We've also heard how additional resource has been provided into the Directorate to support monitoring the financial aspects of the Directorate's operation, and the level of detail that has gone into providing monthly reports to Cabinet, which I believe Cabinet have scrutinised collectively in terms of maintaining an oversight on in-year delivery. The reason that the Task and Finish Group looked at in-year delivery as well as the budget proposals for the coming year was in order to understand the trajectory that the journey that the service areas are on in terms of delivering on the improvement plan, and also seeking evidence and assurance from progress that's being made in year to support and underpin the balance and content of the budget in terms of service area budgets, but also areas of savings and identified pressures as far as next year's budget's concerned. And the reason for doing that is because this Directorate has overspent considerably over the last 2 years, and the budgets that it has been provided with have simply not been the cost envelope within which it's been able to function in delivering its services. So we really want to try and be confident that we can get that right and have some assurance that it's going to live within its means for the coming year, because as a council it creates a significant risk, not just to the council in terms of the continued supplement of its spending from our reserves, but also in terms of savings that are being imposed on other areas of the council in order to fund what is proposed as a nearly £11 million uplift in the core budget for this Directorate for the coming year, as a recognition of what is being termed a structural deficit in the current budget. So in looking at all of this information, we've come up with 7 recommendations, which you can see on page 21 of the supplement. and these cover a range of different areas that we investigated. I'll cover them briefly. One is, the first one is about making sure that staff are made aware of the financial performance of the Directorate alongside other Directorate performance measures in order to broaden an understanding of the financial dimension of the council's, of the Directorate's operation, in addition to the other measures that matter for service area performance. We recommended that Children and Young People's Scrutiny Committee take a closer look at SEND transport in terms of how an understanding of its demands is developed and costs are managed. That Children and Young People's Scrutiny Committee consider doing some work in terms of understanding the step down from residential care for children and the work that's ongoing to reunify families where children have become looked after. And that's really underpinning some of the work that needs to go on to deliver reduced costs in the overall service area of residential home costs for looked after children. That the dedicated financial resource that has been provided continues to be provided and embedded within the Children's Directorate, not only to provide support to service areas but also to provide challenge and assurance that day-to-day costs are being captured and forecast correctly. That in order to give scrutiny oversight more frequently than our every other month committee meetings, that the financial outturn report for the Directorate and the weekly update of the service analysis tool is provided to the Chair, and that Children and Young People's Scrutiny Committee consider undertaking a piece of work to examine the robustness of the Council's data management and the information that supports the Children's Directorate. And I think during the course of this meeting today, we've heard quite a lot about data, how we're gathering it, how we're sharing it, how we're using it and interpreting it, and how we imagine that it is evidencing progress being made in changing and improving how our services are delivered. So I think that was very much a strong thread of the recommendations coming out of the work that the Task and Finish group did. But overall, I think the final recommendation, which is that the savings and that are proposed for the coming year for the Children's Directorate, that assured funding, that if evidence can't be demonstrated and provided in the Q3 report, I think that is due to be made public shortly, that there is not an evidence in year of savings being realised in this Directorate, then it does call into question whether it is safe, given the track record of the last 2 years, to be relying upon £2.5 million being saved, as well as pressures managed and everything else that is part of the overall budget for the coming year. So I think what in the round we found was that significant progress has been made during this year and following on from work in the previous year to improve the understanding of costs associated with service delivery, that the savings that were targeted for this year to be delivered simply haven't been delivered at all as yet, but we have only the Q2 performance report published publicly. We did have sight of monthly reports to Cabinet that went as far as accounting period 7, so slightly beyond the mid-year point. That was for as far as October. We did ask for a sight of any that had been published beyond that, but that information wasn't provided to the Task and Finish group, and so we could only base our commentary on the information that was for the year as far as October was concerned. So we haven't received assurance that there is tangible evidence that savings are starting to be delivered in the savings area, the two primary savings areas that form the budget savings for next year, which is reduced costs for looked after children and a change in the staff mix between permanent employees and agency staff. And given that there is a £1 million saving specifically on the staff line that is scheduled for delivery in June next year, at the end of the first quarter, we would be expecting to see some evidence that savings were starting to be delivered in terms of a shift in the staff mix in the second half of this year, if there was going to be assurance provided that those savings were safe to build into the budget for next year. So that's where we ended up as a Task and Finish group, with some recommendations for this committee, support for ongoing measures to maintain robust oversight of costs within the Directorate, and some concerns over the safeness of relying on savings being delivered next year in order to balance the council's budget.
Thank you, Councillor Harvey. Does anybody have any questions for Councillor Harvey regarding the Task and Finish report? Or if not, what we could do is we could actually vote en bloc. I think that... Oh, sorry, Councillor Kenyon, yes.
Thank you, Chair. I'd just like to congratulate Councillor Harvey on this. I feel this is what Scrutiny is about. What I've sat through this afternoon is great, but so many other organisations and bodies sit through it, and I finally now feel like we're actually doing scrutiny, we're doing work, and this is what this committee is about. So I wholeheartedly welcome it. One of the things I've seen on the sense, and the other thing as well, you assembled, Liz, a great team around you, people that wanted to get into it, and that's what you've done. You've got some great results here. I know on the SENS transport thing, that absolutely needs to be looked at. I know a parent that was told that they can't drive their child to school, or they wouldn't chip in towards the petrol money for that, but they'll pay for a taxi to Leominster and back. So you can imagine how much it was costing every day. But they said, you know, if you contribute towards the fuel, they take it themselves. So there's lots of people, parents with SEN would do that. But there's no conversations like that. That would save absolutely thousands. So I welcome this, and we can highlight issues like that. So well done, Liz. Thank you very much. I feel like I'm sitting on the Scrutiny Committee, even though I was no part of this. I look forward to plenty more things like this.
Thank you. So, Councillor Highfield.
Yes, I was a member of this group, and I think it was very valuable. And as part of the data we were given, let me just precede that by saying that I attended LGA training in Birmingham, and so there were councillors from various nearby counties and districts, and the topic of conversation largely was not potholes, surprisingly. It was the cost of children's services and adult services to a degree. That's what they all talk. They've all faced this problem. Even the Birmingham councillors were not talking about their equality payments problem. They were talking about children and adult services. Now, we got, as a result of this, the LGA, one of the data pieces we got, the LGA gave us a breakdown from companies registry about the companies involved in providing services, the sort of services that we hire. And it was very interesting. And I don't want to criticise Liz, but I did write a commentary on that report, which I thought could have formed part of our recommendations, because what's missing from all of the talk that we've had is a look at the national situation. And the national situation tells us some things. That, for example, the national average cost of putting a child in care is £6,000. It doesn't per week. It doesn't cost us quite that much, but we've seen from data in this report that it's gone up exponentially, and it's now over 5,000 for this council. The latest quote we had for 4 children was over £5,000 per week. And there's a national situation, and from the figures we got from the LGA, it would appear that the care service system is dysfunctional. It is dominated by a handful of companies who are making around about the top ones 25% profit. And yet, somehow, new companies don't come in and say, well, I can do a better service cheaper than that. That's the normal, you know, market situation, but that's not happening. So there's some reason why that is. So what I'd like to say is this report's only just come out, and I'm sure later they'll have a chance to report on it. I'd like to add something in it, because it's a draft, about that issue. I'd like to have an answer as to what the national situation is and what is actually, if anything, being done about it, to look at it. Is the central government getting involved at all in what's going on in the national situation? I'd like to see some question about that, because it is within our terms of reference. So I don't want to expect an answer now, but maybe we can refer that for an answer later.
Thank you. I think in terms of what you're saying, that this is a draft, I don't think this is a draft. I think we need to vote on this now. The question is important, and I think that we could have an update on the question, but as far as I understand, this report needs to go to the Cabinet because it deals with the budget. It does need to go to the Cabinet ASAP, so it's not going to come back to any scrutiny committee before then. But I think in terms of the national picture, we can ask the director now about that, and I will just say that from what I understand and from discussions with the members in Leeds, that this is something that the LGA have raised with the government, and that there is an issue around profiteering in the industry. But I think what we're being told very firmly by the Commissioner is that effectively we need to step down children from that very expensive care. We've got too many children in the care system, and that stepping them down will actually reduce the cost. But perhaps we can go to the director. Councillor Harvey, did you want to respond?
Just before the director speaks, I mean, yes, we did. We did hear that it was very much a national picture in terms of the residential care costs having gone up significantly since pre-COVID. It isn't something that we have the capacity to influence within the county here. It is a national issue, and if there are things that we can do in terms of lobbying government and all that, I think we should look at that. I think one of the things that we did find as a result of diving into some of the detail behind the numbers is that the number of children in care has not gone up significantly over the period that we're looking at. There's been an overall 1% drop actually in the number of looked after children between sort of March and October. There's been a slight change in the number of unaccompanied asylum seeking children, which has been an increase, and that has impacted on the net figure overall. We've made about a 3% drop in the total number of looked after children, but then there's been an increase in the unaccompanied asylum seekers, which means that we've only got a 1% change overall. So the majority of the overspend that we're looking at is not as a consequence of the total number of looked after children that we have in this authority having gone up significantly over the period. That's not happened. What we have got is an increase in, we have high residential costs, and it may be that within the total number of children that we have looked after, the balance across more reasonably priced accommodation versus very high cost accommodation for children with very complex needs is possibly skewed. We didn't see the distribution across the entire cost range of the services that we procure every month. I don't think the number of children went up so significantly between the budget being set and the budget starting to have to be lived within.
That's my point. They're working in a different landscape. It's not about whether the children went up. They're working in a landscape where the costs are considerably higher than they were for the same service.
I mean, I'll be interested to see what the director says about that, because I didn't take away from the information that we had provided to us that there was such a step change in the costs that we were being charged in year as to account entirely for the overspends that we're looking at. But
you've
maybe
included some of them in the report, 2,000 to 4,000 in a very short period. It's included in this report, and now it's gone up more for the current year.
Can we hear from the director, please, just on that point? Is there? I mean, we don't want to go back over the discussions that you contribute to this report, but
I think
clarification.
We're agreed on that one, I think, Chair. So I'll try not to fall into that position. If I just focus on the national context, I think Councillor Powell, when he attended the Task and Finish group, spoke of the Josh McAllister review, Stable Homes Built on Love, and the work that was done there. And there's a significant amount of information, data, and recommendations that were made to government about the national situation and that market, which Councillor Highfield quite rightly points out is largely private owned, a lot of it equity fund owned, and a significant proportion, but not all of it, is making a profit out of the distress of children and families, and where local authorities are the only customer. I've said in the past, I think at this committee and in another forum, and it's certainly the position of the Association of Directors of Children's Services, it is a system that's broken. I think one of the points I did say at the Task and Finish group is actually it's an area where generally speaking, and certainly in the last 12 months, we've performed particularly well in terms of managing our costs down. And you quite rightly pointed out that our average cost is lower than the national average, because we have put a lot of time and effort invested into building relationships with providers and to managing down those costs so that we make sure that children's needs are being met. But it's not a market that we have direct control over. We're a customer, and the exceptionally high costs of a very small number of children and young people essentially breaks a budget for most local authorities. We're in a fortunate position. We are rarely in that position. Other local authorities, there's some very high-profile news in terms of the costs of some placements. I think I want to thank the committee for the work that they did do. I think it was a thorough and robust couple of sessions, and of course we've had the Scrutiny Management Board follow up to that as well. Where there's a time constraint and a relatively narrow focus, there is only so much that it can do. I think in terms of if there are 3 of the 7, or possibly 4 of the 7 recommendations here which add to the Scrutiny Committee's work programme, it might be that Councillor Highfield's suggestion that we get a clearer picture of the context and national picture of placements, that might be something else that could be added to the work plan. But there's a huge body of evidence out there. The LJ work's been mentioned, the SIPFA, and there's the national panel review as well.
Can I just quickly suggest, I know we're really rushing on time, a short 1-sentence addition to this report before it goes in, to say that we recommend that the Association of Directors of Children's Services as a group make sure that the problems nationally are reflected very clearly to central government.
I'd just say that they do that almost daily, certainly every week. It is a high-level conversation that goes on across, but it's also picked up by all county councils and the like across the country. It's a problem that affects all children's services and local authorities at the moment. But ADCS have been campaigning strongly on this for at least 2 years now, and they fed into the Josh McAllister review.
Chair, if I might, it's 5 o'clock, so you're going to have to secure a committee agreement to continue with the meeting.
Thank you. I'd quite like to complete quite soon. Is everybody happy to carry on until we finish, which hopefully will be very soon? Thank you. Okay. Councillor Highfield, are you satisfied that we can actually proceed with the recommendations on this, and that any additional bits of information or work we can feed into our work programme? Is that
yes,
all right
I'm happy, given the time constraints that we're under here, as long as that this is being looked at actively, because it is a really significant part of the problem.
Okay, if we can, we have that assurance that from the director that it is being raised at a national level regularly. If we could please agree to these recommendations en bloc. Some of these will go to cabinet. Are you proposing that? No, you've asked a question. Yes.
Sorry, just there are a set of things, a set of recommendations for this committee. Are we voting that they will be things that we will definitely do, or are we voting that we will consider them as part of our work planning?
I think there are 7 recommendations here. I would suggest that 3 of them you can discharge yourself here, right now, amongst yourselves, and it would be not that you commit to putting those on your work programme, but you consider putting them onto your work programme and you meet separately to determine that. 2 of them, recommendations can probably be discharged verbally by the Directorate of Children's Services in this meeting as well, because there are assurances around data, and I believe he's probably addressed those in the meeting already today. And then there's a final one, the final recommendation on there, which is I would suggest that the Chair appraise the leader of that in Cabinet on Thursday.
I would only be identifying that final recommendation as a recommendation to go to Cabinet.
Thank you for that clarification. So if everybody's happy with that, so it would be the final recommendation that goes to Cabinet, that we have assurances from the Director that we will get the data information as requested. Could you just confirm that, please?
Yeah, I'm certainly happy to share the chat report. Happy to share the chat report and the financial outturn report, yes.
Thank you very much. And then that we add the other items for consideration in our work programme when we discuss the work programming session, which we will have to do outside of this meeting. If everybody's agreed with that, could I have a proposer, please? Thank you. And a seconder, Councillor Proctor. So, right, is everybody, or vote, councillors, can we vote? Thank you. Great. So we will take that to Cabinet. Thank you. That concludes that item. So the work programme, we have agreed that everybody is happy for us to have a work programming session. I think there's a lot that's come out of today that we can actually develop our work programme for the year on. So thank you. And then finally, the date of the next meeting is on the 12th of March 2024 at 2 p.m. And that's it. I think if everybody's happy, we can bring this meeting to a close. Thank you for everybody that's attended. Can we make